Good morning, good afternoon, and good evening from wherever you are joining us from all over the world. I'd like to take a moment here to thank you all for taking the time to participate in the first edition of the APAC Virtual Forum organized by Dental Monitoring. I'm your host, Ryan Scaffey, Clinical Education Officer at Dental Monitoring, saying hello from Paris. I mean, not this one. I mean the real Paris, because this is how it actually looks like 90% of the year. At the time of speaking, it's Thursday, the 5th of November, 6:30 a.m., and this is how our streets currently look like. Not because it's early, but because we're unfortunately back into lockdown for the second time. Only this time, it's different. This time it will be much easier because over the past few months, we learned how to leverage the technologies that we have so we can stay connected with the ones that we love, so we can continue learning, and in your case, continue providing the care that your patients need. And this is what this session is all about. It's about adopting a growth mindset and expanding into the virtual world, breaking down the barriers of time and space to constantly stay connected with your patients. More specifically, our speakers for this session will touch on the following topics. So they will be talking about the new technologies that are disrupting the dental field, the new consumer behavior shift. Who are the new patients of today, the new connected generations? What are their expectations and how to adapt to these new changes? We'll talk about virtual consultations. What are those, how they work, how we can delegate, and last but not least, about the remote care. Now, let's talk a bit about the structure of the meeting. So this meeting will be 2 hours long, 2 hours of pure bliss, of pure knowledge. So stay connected till the end. I promise you it will be worth it. We have 4 amazing presentations, 15 to 25 minutes each, and we have 4 amazing speakers lined up today. So a quick introduction of the speakers of today. First, we have Mark van Wielde from Dental Monitoring. We have Dr. Rhonda Cohen from Australia, Dr. Vandana Katyal from Australia, and last but not least, Dr. Ronnie Yap from Singapore. Now, before we start, a little bit of housekeeping. I guess most of you are familiar with Zoom by now. So on the bottom of your screen, you have the chat and you have the Q&A tab. If you have any question at any moment, please don't hesitate to use them and send your question through. We want this session to be as interactive as possible. So at the end of this session, we dedicated 30 minutes just to answer all of your questions. So without further ado, I'd like to introduce our first speaker for today, Mark van Wielde, to kick off this session. Mark is Senior Vice President, Executive Director of Dental Monitoring and a member of the Executive Committee. He joined DM in 2016 as the Asia Pacific Business Partner. His involvement in the dental orthodontic industry goes back to 2001 when he set up Align Technologies business in Asia Pacific as their Vice President and as their exclusive distributor for Asia Pacific until 2013. Mark, pleasure to have you here.
Thank you very much for joining us. As Ryan said, a bit about my background. I've been with Dental Monitoring since 2015 was when I first met the CEO and founder, Philippe Solar. Prior to that, I set up Invisalign in Asia. Back in 2001, I invested in Align Technology when they were a private company in 1999. So I've been around from the very start. And after Align Technology bought me out as the distributor in 2013, I was introduced to Dental Monitoring and I thought, this is another opportunity for something that could have just as much impact in not only orthodontics, but also dentistry as Invisalign did. So a bit about it, Dental Monitoring, I want to share what we're about. And our mission really is to try and make dental care more accessible to enable you as the dental professionals to provide care at the right time to everyone and everywhere. And we do that by enabling you to provide constant communication and follow up on your treatment progress. The way we do that is to use AI, artificial intelligence, driven remote monitoring solutions that enable you as the dental professional to create a virtual practice and continue your care even when the patient's not in the clinic. I want to start this presentation and look at 3 companies that you may have heard of. We've got BlackBerry, Blockbuster, and Kodak. And as you're already aware of this, what do these three companies share in common? Well, the point was, at some time, they were the world leaders in their respective fields, but today they're almost non-existent. And the reason that they're no longer here is they did not adapt to a changing consumer marketplace. And we have seen a lot of things happen very, very quickly. Technology is impacting our lives in so many different ways. And I think the message to all of us, whether it's in dental, in orthodontics, or in any other field, is that life is all about a continual adaptation. And if you don't adapt, then everybody else continues to move forward. And so in response, you will fade away. This quote pretty much sums it up. And I think if you look at this graph, this is what our life is all about, not just in professional, but also in our personal lives. You start off, you grow, and eventually you mature, and then you move into a state of decline. And where you have to find, if you want to continue the growth, is that next platform to take you to the next level. So what can we learn from healthcare? I want to start off by thinking about healthcare and then move down into dental and orthodontics. Healthcare is the largest and fastest growing industry in the US. They estimate that $3.5 trillion was spent in 2018, and that is 18% of their GDP as a country. Yet in spite of all of that, there are still an estimated 12 million misdiagnoses per year, and up to 50% of all medical prescriptions are deemed unnecessary. And as Dr. Eric Topol in his book, Deep Medicine, points out, right now you have a very high burnout rate for clinicians and physicians across the industry sectors in all forms of medicine, and that includes dental. So to some extent, technology provides a gift to us all. On one hand, it creates the time, but on the other hand, technology takes away time because we have so many competing demands for our time. And I think what we see here, and we'll hear it from our speakers, is that artificial intelligence can make healthcare more human. All right, you're seeing that in everything you do. And he's one of these outliers, Dr. Topol, who believes that even in radiology, which a lot of people think radiologists may start to disappear, he doesn't agree. He believes that radiologists actually will just evolve their role to be much more human-facing and less time spent in front of radiographs. If you look at the number of AI studies and machine learning studies in medical fields, it's almost 8,000 published studies by 2019, and that's only partially through 2019. And if you look at the breakdown of all of those, you see that oncology, pathology, and radiology are the three areas that dominate. Dental, there've only been 190 studies on AI in dentistry. So that is only 7% of what is done in oncology, which shows you that dental AI in the dental profession and the dental industry has been lagging proportionately when you look at the spend that is spent on dentistry overall in terms of care. If you think of technology advances and what's happened in dentistry, there have been a lot. The image on the left I can relate to because when I introduced Invisalign into Australia and Hong Kong in 2001, which were the first Asia Pacific markets, the PVS and alginate impressions were the only way that you could submit a case to Align. In fact, it needed to be PVS, which was a problem itself because a lot of people hadn't used PVS. They'd been using alginate impressions. So this was the way the data was captured, and then it had to be digitized by pouring up the impression and then scanning it through destructive scanning. Contrast that now where you've got intraoral scanners such as iTero and 3Shape and Carestream and others, whereby I think I read in the latest report from Align Technology, somewhere around 92% of all Invisalign cases from US orthodontists are submitted with an iTero scanner. So you can see the transition that's occurred because of the benefits that it offers both doctor and patient. Yet in spite of all of this technology advances in the clinic, very little has happened to one area that has a great impact on what happens to the delivery of orthodontic care. And that is what's happening outside of the door of the practice. And that's where the next big revolution will take place. Okay. The buying habits and the decisions made by the public have changed towards everything we do. And what has been acceptable in the past for the way patients were treated is changing rapidly. And changing patient expectations and technological advances like AI and telehealth, which telehealth became of age during the COVID lockdown, makes it essential that as clinicians, we have to stay ahead of the game and adapt to this changing marketplace. And Dr. Rhonda Coyne, I think, is going to talk a lot more about that. So to understand why the virtual consultations are so important, we need to look at the post-COVID world we are now faced with. So how is dental monitoring using AI to enhance the dental professional's experience? Let's start with artificial intelligence and what is it? I just wanted to give our audience here an overview on what artificial intelligence is and how dental monitoring uses it specifically to help you as our customers. So artificial intelligence aims to mimic human behavior. The goal here is to try and get computers or machines to have the ability to help us as humans achieve our goals more efficiently, and think of that in everything we're doing. And the most audacious goal, one of the most audacious goals, will be the self-driving autonomous car, which companies like Uber and Google and others are all working upon. Artificial intelligence relies on neural networks, which basically are computing networks that try and mimic how the brain works. I think that's the best way to describe that. But it's not just one technology. It's a collection of technologies. Within artificial intelligence are the subsets of machine learning and then deep learning. Machine learning is the computer's ability to learn and train itself through algorithms, but yet without being explicitly programmed. But what it requires is it requires a lot of data at the early stages of development. And there are lots of companies now who are getting into the space that dental monitoring founded, but every one of them has to go through the same path that we have, which is to collect literally hundreds of thousands and ideally millions of data points for whatever you're going to train up your machine to learn. An analogy is really a bit like a baby. You know, when a baby is first born, the baby is helpless and requires a lot of care, and you nurture the baby and you train the baby up and you teach your child. And bit by bit, your child learns most basic things, but over time, that learning accelerates to the point where at some point, your child becomes self-sufficient and can look after itself with very little guidance. As a parent with 3 boys, maybe I can dispute that a bit, but really that gives you a good analogy. Deep learning is the subset of AI, which is what dental monitoring does, and also what a lot of companies in this medical sphere do. And this is where the machine trains itself and performs complicated tasks by working with as many input layers as possible, determining relationships which the computer can see, you know, once we've created those, and looking at how all those relationships interact to then provide the outcome. And this really will determine the predictability and the accuracy of the AI. And our aim is to use this to significantly improve the treatment journey for you as the clinician to deliver to your patients. So now let's talk about how it works with DM. How does it work in real life with your patients? When we started very early on, we just used the smartphones, and that in itself was challenging because there are so many different smartphones, and especially with Android, they all operate slightly differently. So the first challenge for us was to make sure that we had a reliable capture device, being the smartphone, that every patient could use to provide data on what was happening inside their mouth when they were not in the clinic. We didn't want to use anything like an intraoral scanner in your pocket because that would have been far too expensive. We wanted to take advantage of an existing device that everybody has, which is the smartphone. But we quickly worked out that one of the challenges to using dental monitoring was the fact that it was pretty hard for a patient to scan their teeth from home just with the smartphone. There are too many elements involved with it. So we actually worked for a couple of years on how to create a much better process. And we developed the DM scan box, which is what you see here, which attaches to whatever smartphone and then attaches to a set of cheek retractors, which have little gimbals and magnets on them to enable anybody within a couple of minutes to take standardized photos in a very easy manner. And the quality of your photos is very, very important when it comes to AI, because if you don't have clear photos and the photos are not of consistent format, then it's a lot harder to detect and extract information out of them. The processes that occur is that every time a patient scans, there is somewhere between 30 and 100 different images that are taken. So as you sweep from left to right with a closed bite, with an open bite, if you're wearing aligners, with the aligners in and then without the aligners in, and then doing the scan up and down to capture the bite and to capture the occlusion, those images are all uploaded, compressed and uploaded onto the DM AI network. The first thing that happens is the images are cropped. This is all done in AI. There is no manual interaction here. Then the second thing that happens is the labeling of the images, because there is a lot of information that needs to happen. And then lastly, the processing of the information using the AI networks that dental monitoring has developed. So this will give you an example here of what we're looking at. These are the cheek retractors that DM has developed that attach to the scan box via little magnetic plates. And you can see here this patient's in aligners and taking scans. So these are the raw image, firstly, that are taken. Then the images are cropped, again by the AI, automatically cropped, and they're extracted and presented for view to the doctor in a form that doctors want. So they're not as good as intraoral photos taken by a doctor in the clinic with a professional camera, but I think you have to admit they're very good considering they're captured by a patient in just a few minutes every week. So normally the intervals for scanning for aligners is somewhere between 5 to 10 days, maybe up to 2 weeks. And for braces, probably between 2 months and 2 weeks and a month. The first thing that happens is the AI detects the teeth. So again, automatically, this was something that Align Technology certainly couldn't do early on. They can probably do it today, is that based upon the images that are submitted, we automatically detect the teeth. The second thing is the detection of the gingiva, where the teeth start and stop and where the gums start, which is very important again in terms of image recognition. And then next is where we identify and tag lots of different clinical situations in the mouth. So in this particular case, if you're looking here for the 1-1 from this one image, dental monitoring's AI detects that this tooth is a 1-1 with a 99% accuracy. Similarly, the 2-2, a similar rate of accuracy, which makes sense. But then if you look at the 3.5, and we've had to blow this up here just to show you, the accuracy is only 53%, which isn't good enough from this particular image. And the reason it is so low is because this tooth is a bit obscured from view, being on the buccal corridor. However, when you sweep around, and remember that we take up to 100 different photos, and you get the buccal views, then that score, again, will go up towards 99%. And the predictability score that we've got is what we use that, looking at all the different photos that are taken, and we use it to combine and aggregate to increase the accuracy level. So if it's 99% on 4 or 5 different images, then that very quickly approaches close to 100% certainty of what's being identified. To come back, when it comes to predictability score and the certainty and the percentage certainty of the detection, and we talk about the accuracy, it's actually quite a complicated subject matter. And I've been reading up on it myself after talking to the head of the AI department. If you look at sensitivity and specificity, and you even think about how it works with COVID tests, you understand what has to happen and the 2 variables that someone has to make a judgment on to see whether a predictability score is a score that's worthwhile in terms of delivering the desired results to you as the clinicians. So some examples of clinical situations that can be detected by the AI. Here, this screen shows the sorts of things that can be detected, from gingivitis, detecting the aligners and whether there is any unseat on the aligners, missing attachments, whether there's any recession. Again, the bottom image in the center shows a noticeable unseat. And lastly, whether there's any missing brackets. And the way it works is that dental monitoring isn't just looking at what's happening in an image of the mouth taken right now, but it's comparing what's happened in a patient's mouth to images from a week ago. And again, not just from one image taken now, but multiple images compared to multiple images from a week ago, and so on. So it's the ability to look at sequentially what's happening over time that allows us to pick up changes such as a change in recession, whether there's deteriorating oral hygiene, or in dentistry, whether there's a change in tooth color. Finally, I'm going to move on to the DM solution suite and what we do. So today, we've been around 6 years since when we first started the company. We've raised in excess of $100 million US, and we actually have about, I think, over 100 orthodontists and dentists who've actually invested in our company. So we have a lot of people early on who identified that what dental monitoring was doing was a real tool that could help them deliver the outcomes. In total, we've got about 6,000 orthodontists and dentists registered on the DM platform. And those doctors have monitored and assessed in excess of 500,000 patients, and that number is growing rapidly. We've got over 500 million images that have been processed through our AI platform, and that number goes up exponentially all the time. And the more images we get and the more we run our AI algorithms, the more accurate they become and the more algorithms we can develop. So to date, we've got an AI platform that can detect approximately more than 100 different clinical situations in a patient's mouth. Those things can range from whether there's any braces on the teeth, the identification of the tooth number, whether there's any recession, any tooth wear, whether there's an aligner on the tooth, whether the aligner is unseated, whether there's a missing attachment, all these sorts of things. In total, we have 120 patents issued and pending, and we work very, very hard as being one of the leaders in this field to ensure that everything we do is compliant with the regulations that govern patient records and privacy in jurisdictions such as the US, Europe, and in Asia Pacific. So I think in total now, We've got more than 300 people currently working in the company across 6 different offices, with our headquarters and our development center in Paris. But now we have an office in Austin, Texas, in the US market, which is now our largest market, as well as offices in Hong Kong, Sydney, UK, and other places. I think when I first met Philippe and got involved with dental monitoring, there were only 40 people. So it's come a long, long way very quickly. So what are the dental monitoring solution suites, the suite of solutions? You know, our aim and what we want to talk about today, and the speakers will talk about more, is to enable you as the clinician to create the virtual practice. And the elements of the virtual practice, we've created 3 products to help you address your needs. Now, we continue to develop these and we'll add to them to deliver this. And I guess this is a never-ending journey for us. But the first product that we want to start with is SmileMate, which enables you to assess and to triage a prospective patient's oral condition. Vision, which is a treatment simulation tool to simulate whether you've got what a patient will look like with appliances and what their teeth can look like after treatment. And then our core product, which has been around since day one, but initially not with AI. Initially, everything was done manually, and then we developed the AI as we scaled, is the remote monitoring. So firstly, with SmileMate, which I think Dr. Vandana Katyal will talk about. SmileMate is a tool that enables you to recruit more patients. And it enables you as the clinician to carry out a virtual consultation and run that consultation around an automated assessment that's been created by dental monitoring that identifies the essential conditions in the patient's mouth, gives them to you as the doctor, which is important. You get them within 10 minutes, and it's really up to you as the doctor to determine how you want to communicate those with your patients. And Vandana will talk a lot more about that. So when we launched this during the COVID period, we knew that patients couldn't come to the clinic. So while the tool was initially created to be used in the clinic, we realized that it needed to work on a doctor's website, enable patients to do this and take photos themselves from their home, even without cheek retractors, and to be able to have that interaction with a doctor via a virtual consultation. The second tool is Vision. So Vision enables the instant simulation for better orthodontic case acceptance. This first instance here, if you look at the image on the left, it's a virtual typodont. It really shows a patient what they're going to look like during the course of treatment with whatever appliances the patient and the doctor agree that are going to be used. So you can show a patient what they look like with aligners, what they look like with different types of braces, showing colored O-rings and other accessories, and then having the ability to do it for different appliances on one arch and the other. And we're going to extend this outside of orthodontics as well. And the second component of it is the instant simulation tool, which is going to help you for better case acceptance to quickly show a patient before you do a diagnostic setup and before you create something like a ClinCheck or any other form of simulation, for a patient to quickly see what they can look like. So this is really the teaser to show a patient, I really should be doing something about my teeth. And then you as the doctor would use this tool the same way that you would use the ones that are created by other companies to show patients what you can do. And here, it doesn't matter how you're treated, whether you use aligners, whether you're using what brand of aligners, braces, and in due course, we will do restorative dentistry, whitening, and all those things. All of this happens within 10 minutes, and we're about to launch this so that patients can also do it via a doctor's website. So again, a tool that's going to not only aid in acquiring patients, but also improve the conversion rates. Then lastly, we have dental monitoring, which enables you as the doctor to monitor all your patients remotely. And Dr. Ronnie Yap is going to talk about this in more detail, but really this is the core of what DM developed. And I think we're the only people who can really do this in the world, just because of the fact that we've been doing it for more than 5 years to date. The elements are, there's a doctor dashboard, which is the portal in which DM communicates with the doctor, and the patient then sends communications to the doctor. From this, the doctors create their own monitoring protocols to determine what particular situations they're interested in being notified of. And from those situations, the detective, what actions do they want taken? Then you have the patient-facing mobile app. So having a mobile app that works across all the various different types of phones, which enables the patient to upload the photos taken with the DM scan box, and then those photos, from that, the DM AI detects all the various things that we've talked about, up to 100 different clinical situations in a patient's mouth. So the DA will extract the information, the AI will extract the information, and then send, based upon the doctor's chosen protocols, automated messages to patients, as well as automated instructions to the team. So the key to make this scalable is that about 99% of it can be automated. There's still 1%, maybe a bit more, that needs to be personalized with individual instructions created based upon what a doctor sees every time he gets a major alert. And Ronnie can talk about that in due course. So I want to finish today, and this just shows the dashboard, and Ronnie will talk in more details, but here's an aligner patient, a very good patient, with 50 aligners, and you can see that the green circles, they indicate that every time the patient takes a scan with their phone, that this particular patient is being given a go to change to the next set of aligners. The red squares, they represent when a patient gets given a no-go because the aligner is still not fitting properly. And then based upon the protocols, the doctor tells the patient to wear the aligners for an additional period of time and then rescan. And you can see here, this really is what DM enables you to do. And I wanted to finish my presentation talking about what I think is a very good analogy. The thought occurred to me after 13 years working with Align Technology and Invisalign, and now 5 years with dental monitoring, that in spite of all the technology advances, orthodontics is very inefficient. And it's taken something like dental monitoring and to create the field of remote monitoring to really show how much treatment outcomes and the delivery of treatment can be improved. And the analogy I like to use is that of driving a car and comparing orthodontics to driving a car. So just bear with me a second. Imagine that 1 week treatment interval in orthodontics equates to 1 second when driving a car. So if you're not using dental monitoring and you're practicing orthodontics like most orthodontists, it's like driving your car down a freeway and closing your eyes for 8 seconds, which is equivalent to an 8-week appointment interval, and then opening your eyes and seeing where your car is on the road. It's not going to be in the lane. You'll be lucky not to have run into another car. But this is how the way that orthodontics is practiced today. And it means that you then have to get the treatment back on track if anything's gone wrong. And this process is particularly accentuated with aligner treatment, okay? But it works the same with everything. It doesn't really matter. Now, if you're using dental monitoring, instead of closing your eyes for 8 seconds, because you've got the patient scanning their teeth on a weekly interval, it's equivalent to driving a car and keeping your eyes closed for only 1 second. Now, if you only close your eyes for 1 second, you will still be in the same lane. You may have just got a bit too close to the car in front, but all it requires is a small adjustment. So I think that analogy demonstrates how dental monitoring makes the delivery of any orthodontic treatment, or for that matter, any dental treatment that requires monitoring on an ongoing basis. And it makes it work more efficiently, quicker, with less appointments, because what you're doing is you're doing everything else remotely that doesn't have to be done in the clinic. And early detection means that little problems never eventuate into big problems. So on that note, I'd like to say thank you and hand back to Rayanne. and I'll be available for questions later on after the other speakers. Thanks, Ryan. I'm just going to stop sharing.
Sure. Thank you very much, Mark, for this great presentation. Again, I remind everyone who is participating, if you have any question, please don't hesitate to put them in the Q&A, and we will answer them at the end or maybe along the way as you ask the questions. So, introducing our next speaker for today, we have an absolute pleasure to introduce Dr. Rhonda Coyne. Dr. Rhonda Coyne studied dentistry at the University of Queensland, and she is a 1998 University of Melbourne alumnus. Upon graduation, she joined her father's family practice in Cairns and now runs 3 practices in regional far North Queensland. From a family of specialists and teachers, she takes a special interest in all forms of education, technology, and professional development, and is dedicated to being the best she can be. She has presented widely on a range of topics, both inside and outside of orthodontics. And last time I met you, Dr. Rhonda, you were telling me that you were even competing with your father. That's how much of a competitive family you are.
Thanks everyone for joining us this afternoon. I just wanted to a little bit talk about why we should embrace virtual options in our practice, and like what the advantages of doing it and really why we should do it, and set up the scene as to leading into what Dr. Vandy will talk about, and then what Dr. Ronnie will talk about. And Mark's already covered a little bit about the AI and the amazing benefits that it has for the practice. So we want to just move into that. So why virtual practice? As I said, these are just quickly the few little things that I just want to make sure we cover across in the next 25 minutes or so. A little bit about our new patient demographics and how that's changing. A little bit about what these expectations that we have of these patients, what that means now for our integrated team and how that's going to work together, and what our new normal is likely to look like, given the fact we have new consumers and we also have this new post-COVID world that we're now working in. So really quickly, I practice, as Ryan said, in Far North Queensland. That's my email address, but you can reach out to me via that if you've got any other questions, or through your account executives. But some things that you really need to know about me and about how I work in practice is that I have about 80% aligners, and that's mainly my shared chair is largely aligners. I am an early adopter of technology. And then what that means is that I'm going to be very quick to try and incorporate new and particularly digital technologies in the practice. My practice management software is Dolphin. I like to follow lean management principles to be as efficient and effective as I can. I love systems, and I like redundant systems in the practice. And that means that I always want to have a backup plan for doing whatever we're doing. And I'm always looking for continual improvement, personally, professionally, for the practice and everything else. So that's kind of my philosophy on life and how we do what we do. So I'm not a magician, an economist, an IT expert, infectious disease expert. I am an orthodontist, that wet-fingered orthodontist that practices. I am a KOL for dental monitoring. And I talked about embracing digital technology and AI and aligners well before we had this crisis that we have now. And in fact, I was talking about future-proofing my practice back in 2010. And I know one of my strengths is that I lead with strategic thinking, and I think that has really helped me greatly and helped the practice, and I think helped my patients, and able to incorporate these new and amazing technologies into doing what we do. So my DM journey looks something like this. I was one of the very early adopters in Australia back in, when I first met Philippe, back in February 2016, we started to use it. And then by August 2017, when our Go Live feature came on, everybody was on that. And then we talked about owning appointments. And this is when appointments only when needed for patients in the practice. And we instituted that back in 2018. So since 2018, it's had a profound effect on the practice in terms of just the schedule and the number of people not coming in who don't need to come in. So and that was all of our aligner patients. September 2018, then we had all patients, the braces and the aligners are all on dental monitoring, and we started to incorporate SmileMate and Vision in earlier this year prior to COVID, and obviously that was fortunate because then we had COVID. So that's kind of been my journey getting along to where we are. But if we just stop and reflect a little bit, what's the traditional patient journey like in orthodontic practice is usually we have some inefficient first appointments, and that means things like, you know, they come for a consultation, but they haven't been to the dentist. They have to go back and have a dental check. And then we make them come back for records. And then we might come back for a consultation. And there's a whole lot of potentially unnecessary appointments in there, which isn't very efficient for time for the patients and for anybody else. Patients often don't know what to expect at those appointments. We know as the orthodontist what we're talking about, but maybe not so much for the patients. And then we might see them, and they're 4 and we don't want to start treatment till they're 6 or they're 8, or we might see them too late. So trying to work out the right timing to start treatment and when to see the patient can also be inefficient. And then if they're on review, so we've seen them, they're not ready for treatment, and now we're going to place them on review, there's often lots of unnecessary appointments through that process, or we're just going to see them every 6 months until they're ready to start, because we don't want to miss the opportunity of the right time to start. And in those spaces between appointments, there's often not a great deal of communication between the patient and the practice. So then we've had treatment and we've got to the end. And then what happens after the retention period, that post-treatment relapse that can happen if they're not wearing their retainers. And so this sort of traditional new patient journey, we can really turn it on its head if we embrace the power of all of the options of the suites of virtual practice that we can implement. And that's what I think is really exciting. And that's what I do in my practice. So if we think a little bit now about our new patient demographic, what do we know about them? So the centennials that we're talking about, our centennials, which are the teenagers of today, these are our Gen Zs. They're tech-dependent technoholics. So they are looking for things that are more convenient, less time-consuming. They want more connection with their doctors, and they want more affordable treatment. This group of individuals are very different from the generations that have gone before. They believe in the triple bottom line. That is, people, planet, and profit is important. They are looking to make a difference. And as a group, they're very health conscious, but they're quite pragmatic. So we need to think about how we're going to engage with this particular group of them. And they make up about 25% of the workforce now. How we're going to engage with them and make it a beneficial experience for them. Because if they're not engaged with us, they will go somewhere else that will engage with them. Now, this group of people also, they've never known a world without the internet. They've witnessed directly, or they've been affected by a financial crisis from the 2007 onward. They've never known a world without global terrorism. What an amazing thought. Not a bit of a scary thought. And as well as that, they've also just witnessed a global pandemic, the likes of which the world has not really seen in recent times. So there's some very interesting and very important differences about this group of people and new consumers. And if we talk about them, so I'm Generation X, I'm really into balancing work and family time. So the time I've saved implementing my virtual technologies, I've actually chosen to spend that with my family. But it's very different from the Gen Ys, who don't confuse career and life. But Gen Zs are the guys that are always on. They are connected all the time. So if I don't have my phone, it might be a bit of an inconvenience. If Gen Zs don't have their phone, if the centennials, that is a major existential crisis for them. And they want to be connected. They are constantly connected. We need to recognize that. Otherwise, we're going to disengage with this consumer group. And it's the growing consumer group that we have. They're a very important part of it. And as also what they're into things is as I said, they're digital natives, but they value experiences over things. So seeing is believing. They need to be engaged and they want it to be affordable, and they need to be connected about what we're doing. And that's really important in terms of they need to have a slick consultation, an efficient consultation. They only want to come in once. So they want to have their scan, and if they possibly can, they want to start straight away. So these guys are very aware of engaging with them and making it as efficient and effective as you can. And truly digitally native means that they're born after the digital revolution, and they weren't incorporated into that. Really different. They think very differently to us, and sometimes we can not get our head around them. So as the orthodontist in your practice, I think it's really important that we need to think about why we're doing what we're doing, and why that traditional patient journey, which was perfectly acceptable previously, we need to think about doing this differently. So how and why we do things. Should our priorities be reordered? There's lots of people at the moment in this post-COVID world thinking about, should I actually do something more important than what I'm doing now? So the attitude to change has changed through this current crisis we've been on. People are looking for flexible work arrangements, and they're actively looking for digital alternatives. So you need to be engaged with that, and you need to offer some digital solutions to engage with that. They're also looking for crowd-friendly and COVID-safe environments. So lots of people aren't going to go out if they don't need to go out, or actually they're in lockdown, they can't go out. We need to factor into that. So this whole process at the moment is a catalyst for change and to do things differently. And I think that's a really important bit to do. So the expectations from this group, because we've identified that they're a different group, and the change in consumer behavior that involves is this self-checkout and service is what they're looking for. Contactless engagement. They need to be engaged, that's very important, but it will be contactless. Now screening requirements are seen as an acceptable norm. And in fact, telling anything is now far more acceptable than perhaps it was before. And again, they're going to question the value of things. Why are we doing that? Is that important? Is it essential? What's the purpose of that? But they'll handle that in a very pragmatic way. So what that really means is this current situation, we have a bit of a perfect storm for actually moving with our new consumer groups, plus the COVID crisis. And we have the whole pile of digital companies, and tech has come to the rescue through the dental monitoring suite of software, helping us move from the physical world to the virtual world. And that's moving from analog to digital. And the new world we talk about now is phygital. That's the physical and digital world blending together, and how we set up our systems in place for doing that. This is going to help us work and live in our new normal, in whatever that's likely to be. I think we're still working out what our new normal will be, but virtual practice is essential, I think, to working in that. So we're working in a phygital world now, very different from what we've done before. And it's very exciting what we've done before. It shouldn't be threatening, it's very exciting. So our consumers expect, as I've already said, convenience, and they want authenticity, and they want affordability. So we need to be able to deliver what we're going to deliver in a cost-effective way for people. And as well as that, what they want to know, and this is how we can use all this suite of digital technology, is will it work? Are my liners going to work? Is what you're doing going to work? How long will it take to get me from A to B, to get my teeth straight? And how much does it cost? And using some of the stuff that Ben is going to talk about with SmileMate, and then with the remote monitoring, we can allay those fears and meet those needs of this new consumer group. So exciting times. As well as that, they need to feel important and engaged and cared for. And that means it's no longer going to be appropriate, or it's no longer going to be possible just to ignore them between their appointment intervals. You're going to have to engage with them and be connected. They want to be connected with you as the doctor. And that doesn't mean coming in the front door. That actually is going to mean the way that you're speaking to them via your technologies and your notifications. And remote monitoring and dental monitoring actually helps fill that need for them. And that's really, really, really important. So that means also from our team's point of view, our integrated team, what they're going to be now is having a very, very, very different team member. So our team members, our dental assistants, and our hybrid employees, as well as the world we're living in is going to be phygital. Our staff are going to have to be able to embrace virtual care and blend the digital, as in what we're going to monitor the patients remotely, but also when they're actually come into the clinic in the physical sense, how we're actually going to care for them for those appointments when they come in. And the team needs to be empowered to embrace virtual care and how we're going to blend this together. So they need time to do that in the practice, and they need the ability and the empowerment to do so. And in some ways, we're talking about dedicated tech teams in the practice. So for me, that means I've got somebody that kind of helps with when we're doing retention monitoring, someone's helping with the retention monitoring, somebody else is doing just the routine braces monitoring, someone's doing some aligner monitoring, and then we're just starting to roll out our pre-treatment monitoring, and that's going to be with my TCs who's going to be in charge of that part as well. So I have like one sort of senior DMC, that's my dental monitoring coordinator, but under that we have other people that are helping out with that. And it wasn't even close to being like that back before 2016 when we started to use this technology. So we're having a revolution just around the world around us, but also amongst our members of our team. And what I aim to do, and I think it's important, is to have systems in place. So you have systems in place for virtual initial appointments and a structured way to monitor your monitoring. So I have some systems in place that just check that we have what we need to do, and we check what we need to do at the appropriate time. And as I've also said in there, that respects my dental monitoring coordinator's time, so that they have chunks of time to do what they need to do, because seeing a patient on the computer is just as important as seeing the patient when they come in and in the chair physically. So you need to allocate time to do that. And everyone has to recognize that they are equally valuable in terms of time spent for staff and for doctors when they're doing that. And I have a systematized way of monitoring these virtual appointments and also monitoring the patients. And then when we go back in and we check it. And I also like, as I said, like to have redundant systems. So we've got stops and checks and backups to make sure that everything else is working as it should. And that helps us identify an efficient way to identify the own appointments. And that's the only when needed appointments. So I don't make the patients come in just because I used to always see them every 8 to 12 weeks. Now I only get them to come into the practice when I need to see them, and those appointments only. It saves time for the patient, but it also saves a whole pile of time for us, the staff, and PPE, and all the rest of the things that go with that. I think that's important to set up your systems around this. So owning your own appointments, and that's when routine office visits are replaced by these virtual visits, and only when needed do I make someone come into the office. That means that my appointment book has loads more spaces than it had prior to 2016, and even it gets better every year. And you can spend that time actually seeing more patients if you want to, or you could spend that time, as I do, working on my work-life balance, like the good Gen Z that I am. So how AI makes life easier for the patients and for the doctors and for the staff is that what we're really talking about is comparing the self-assessment of photos versus AI doing assessment of photos. The self-assessment of photos is very labor intensive. It assumes that you are not distracted, and it can be very inefficient. But artificial intelligence, you can scale it very easily. It's the perfect employee. It's going to work 24/7. There's over 180 clinical conditions that we can monitor, and it's at the pixel level. So it's very consistent, and it's very repeatable, and it's very timely. And every day, as Mark was talking to, machine learning makes it better and better. And that's very, very powerful. And if we think about the scalability of this, for every 100 patients monitored, if I've got to look at photos, that's going to be about on average 3 minutes per patient. And that's assuming that it's actually not, that's the minimum amount. It's often going to be more than that. So it's going to take me about 5 hours to look at 100 patients if I'm just looking at the photos that I've got to assess. Versus if I use dental monitoring, it can detect it and send me the alerts according to my protocols that I've already set up. And if it takes 3 minutes for 100 notifications, that's going to be about an hour's worth of work. And it's much more efficient to be monitoring it. And that's the absolute power of scalability of harnessing AI in our dental monitoring patients. But let's have a quick look at that. So this is my dashboard. All those little greens make me feel warm and fuzzy inside. As you get the green dots closer together, I've actually changed the scan rate here for this patient because she was on track until something happened here. But anyway, those red squares are the no-goes because there's something is going off track, and we have a look at that. And then when we do that, we can zoom in and see it's actually the tutu there that is not tracking. Now that's the first time that this tooth hasn't tracked. And then what I get is a notification that's telling me that there's a noticeable unseat on the tutu. There's also some calculus around the 3.5. Now for me, the way my protocol is, that's just an information alert for us. We haven't stopped the patient. We haven't done anything with that at this point in time. But for here, what that means, the patient has got a message that says you can change your aligners, but make sure you use your chewies where there is lag. And I've explained in the lag, that slight space between your tooth and the aligner when you're wearing it. And then we can continue to review that. So, I mean, that's so engaged. And then the patient can message us back, and we can have this dialogue and communication that's happening all the way through, not just at their appointments, but between appointments. So as this slide is showing, automation of the communication is that AI can give instructions to the patients. They can ask us messages and questions, and I get stuff on the dashboard that sends instructions to the team. And then from instructions to the team about what we want to do, we can then communicate back with the patient. Much, much more connected. And they also, their behavior alters slightly when they know that somebody's keeping an eye on them. That's the Hawthorne effect. So it's very, very powerful with what we can do with that. So our new normal. For me, the new patient journey now looks something like this. A virtual initial consultation. And then from that, I can use that as a bit of a screening tool, and we can decide when we actually need them to come into the office. And then we can do, using our vision stuff, we can show them some treatment simulations, and we can show them what their appliances might look like. Then we can go, if they're ready for treatment, they can jump straight into treatment monitoring, but otherwise we're going to use some pre-treatment monitoring virtually and only make them come in when they need to come in. And that's when we're going to use dental monitoring through all of that into the retention monitoring. And that's all part, I do about 2 years in my practice of retainer checks after they finish active treatment. But now we're also moving into post-treatment retention monitoring. And again, we can keep an eye on them virtually and only make them come in when they need to. And everyone's pretty time poor these days. So being efficient and effective about your appointments and just making them come in when they need to, not because you think they like you, is a huge time saving to them. And so the reasons that I like to use all of the suite of DM software, but particularly for SmileMate, is I'm building rapport before the first appointment. And I can set some expectations when we send that report out about what's going to happen, how much it might cost, all the things that we're likely to do, the records we need. I can use it as a screening tool. So no longer am I having the patient come in who's got like frank decay, because I can say, hey, it looks like you've got a hole in some teeth. Make sure you go to the dentist. Let us know when you've been, and then come and see us for an appointment. So we're not having so many wasted appointments at the early part of it. And we're really turning that traditional new patient journey completely on its head. So SmileMate and Vision tie into that. And then when we get into using the dental monitoring, we have a better patient care because I'm keeping an eye on them more frequently. We can pick up stuff before our eyes are closed for 12 weeks, but much, much sooner, within a week, depending on the scan interval. The patients are much more engaged. I have fewer in-office visits. That has big schedule benefits. It can have some revenue benefits as well, depending on how you want to use that extra time. I have far fewer refinements and I have fewer unplanned additional aligners. And it's the unplanned additional aligners I like to avoid. I don't have as many unanticipated appointments. I know when the bracket is off. I know when a wire's out. I know when we have to talk about oral hygiene. And I use it as a practice differentiator because I am a virtual practice as much as I possibly can be. And our new normal, this is where we're going to be moving to, is virtual consultations are going to be the new norm. Remote monitoring is a game changer. You need to own your appointments. Only when needed do you want patients coming into the office. You're going to set up your virtual office alongside your physical office, and you have to be able to blend these together to be really effective. And you're going to have some changes in how your team members think and work and function, and support them in that process because they're absolutely integral to making this successful. So don't just apply some band-aid solutions just to survive. You want to implement solutions that are going to help us thrive in the virtual era. So in the future, and particularly sort of we're now over the initial crisis of COVID, we want to be able to set up some systems in place that are really valuable and beneficial and help us thrive in this new normal that we're working on. So how are we going to prepare for the next crisis? But I like to think of it more as a revolution. You want to virtualize your patient journey. And so it isn't like it used to be. Using virtual consultations, the SmileMate, using your vision resources that you have there, treatment monitoring before, during, and after treatment. And that helps you develop some really strong recurrent communication systems and channels. Or, as I like to think about it, let's get digital. So why we should embrace virtual options, because again, in summary, it helps us build rapport before the patient is even in the practice. We can estimate time and cost so that the patient, before we all get further committed and we've worked up a treatment plan and the patient could never afford that and wasn't going to go ahead, we can use that as a bit of a screening tool. We can wow our patients with outstanding service that they can't get anywhere else. It can save us some time and some money. If we're in downtime, we can use that efficiently. We can carry out consultations from wherever we are, and we don't actually have to be in the office to do that. If someone needs an opinion, they can actually get that. How incredibly empowering and valuable is that? it's convenient for both for us as the doctors, but also for the patients. And at the end of the day, ultimately, it's the ultimate socially distancing tool, using virtual technologies to your advantage. So really, why a virtual practice? For that, I would like to say, why would you not want to embrace virtual practice? So I think we're running pretty close to time. We'll look forward to some questions more to that in the end. And I hope I've really excited you as to how you can actually use your all of the suite of dental monitoring and the virtual practice to make it a new and exciting place.
Thank you very much, Rhonda. I think your message came across very clear and strong. Everyone who was listening to Rhonda, keep an eye on the next generations, see what they want, and let's get phygital to get the best of both worlds, right?
That's it.
So, who's ready for round 3? We have a great speaker coming up. It's an absolute pleasure for me to introduce Dr. Vandana Katyal. Dr. Vandana completed her Doctor of Clinical Dentistry in Orthodontics from the University of Adelaide and membership in orthodontics from the Royal Australian College of Dental Surgeons and Royal College of Surgeons, Edinburgh. In 2019, she completed an MBA at the world's most innovative design thinking bootcamp from Stanford University. Dr. Vandana is also an avid lecturer at national and international orthodontics conferences. Recently, her research has been featured on Channel 9 National News, ABC Radio, 4BC Radio, the Daily Telegraph, the Sun Herald, as well as the Bite Dental magazine. A true passionate and forward thinker. Dr. Vandana, it's an absolute pleasure. The floor is yours.
Hello, thank you for this
second.
wonderful introduction, and not only that, the opportunity to present for a wonderful, innovative company that I've believed in for so long. And, you know, it's revolutionized my practice. I could not, sorry, I'm just trying to work around this video. I couldn't actually now treat or do orthodontics without this. An excellent presentation from Dr. Rhonda Coyne, who kind of really set the mood of why go digital. And I think today I've lectured a lot about dental monitoring and, you know, but today I wanted to take a step back into marketing, which is really something I really enjoy doing. Marketing is fun and I'm very passionate about it, and how SmileMate helps me. So I'm going to talk quickly. Ryan has already given a very, very good introduction, but I'm a specialist orthodontist. I run a couple of practices in Mosman and CBD. I've treated just in a very short period of time over 1,000 aligner cases so far. I've got about 90% aligner practice now. And I've probably put through close to 700 patients on dental monitoring, probably more. I was probably one of the first orthodontists, just like Dr. Rhonda Coyne, to jump on dental monitoring, perhaps very similar to the time that she jumped on, maybe even a little bit earlier. So I was raving about it from day one. I mean, this was back in the day when it was the clunkiest app, the clunkiest piece of equipment or technology. But the company was so innovative that within 3 months, they listened to their users, to their doctors, and they innovated so fast that they made the product dental monitoring so much more user-friendly for doctors and our patients. And now we know there's research from Dr. Steve Saman in the Gold Coast, a paper recently published, that shows patients love this technology. They love reduced chair time. They love not traveling to you, actually. And then our paper that is just going to be published very soon in the American Journal of Orthodontics, also looking at aligners and dental monitoring, shows that we reduce chair time by 40% and improve predictability in the anterior region. So I'm not going to here talk about dental monitoring too much, but, you know, I'm converted. I'm a lecturer for Best Orthodontic Seminars in Session. That is my college that I run in Australia. And these are my degrees. And as Ryan said, I've been to Stanford University Design Thinking and Innovation School that really teaches you how to disrupt. You know, the best innovations are disruptive. Invisalign was disruptive. You know, it's about something outside the box that was thought, like plastic moving teeth. I mean, who would ever think that? This is my practice. It's been dental monitoring, using dental monitoring for a very long time. I'd say as far back as nearly 2015, maybe 2016, early. COVID really changed a lot. So I had jumped onto SmileMate about a year ago, and we were kind of, playing around with it and not really using it to its full potential. I'm an early adopter like Dr. Rhonda, so I jumped on it very fast and just trying to test and see what this was all about. SmileMate is powered on the AI-driven in dental monitoring, so it's quite a robust tool. But SmileMate was, I think, such a simplified thing that was created that made such a huge difference. So I never believed this would really get me kind of going, wow. And when the pandemic hit, as we know, we were one of the first practices to shut down, and we shut down for nearly 3 or 4 weeks. And when we shut down in March, and literally in April, we were using SmileMate in a rudimentary way, and we kind of integrated it to our website. And we did not do any paid advertising. We didn't say anything to anyone. We basically did an email newsletter, or we just told our referring dentists, hey, for your patients now, we have SmileMate. Just go to our website. And I just never knew the power of this tool until today. And I mean, even a month ago, I'm telling people I'm so impressed. I'm going to tell you how simple it is. So SmileMate is about AI treatment reporting. Now, you as the doctor are in control. You choose what you agree with and don't agree with, which is really important. But it's helping you in the background pick up things. It gives you really quick results. Literally, patients' photos are there, and like within a few minutes, the report's generated. It's online, on the phone, people can do it, and it's really low cost. I don't think the value it has provided me, it's immense. It's immense. I think the cost is not even an issue. Same as dental monitoring. When you look at the value it delivers, I mean, the cost is not even an issue. So simply put together, what is SmileMate? It's just a doctor platform where you integrate it into your website. That is the best way to use it. Patient visits your website. They submit photos. They've got examples of how to submit photos. And sometimes they have professional photos done with a previous doctor. And they even now submit a smile photo of themselves. They write down a little summary of what they want fixed. What is my chief concern? What I love is you get their postcode, you get their email, you get their mobile. Otherwise, they cannot upload photos. And then you as the doctor get notified by text and email, hey, someone submitted a SmileMate screening. What means is they've given you a lot of information. That information is so valuable that now you have this opportunity that we never had before to develop a fantastic relationship with the patient, even before they stepped in your door, even called you, okay? So now you can choose to share this report, you can choose to modify it, you can choose to not share it and do it your way. And that's why I love the SmileMate thing, okay? Before I go into this video, actually, I would like to talk a bit about this. So as part of what I do for education, I run a diploma, right, in Australia, and it's 100% online now. I've educated over 400 to 500 dentists, orthodontists, and orthodontic residents in clear aligners and dental monitoring. And we started talking about this about 2-3 years ago, educating. And I was so impressed with SmileMate that I started writing a book called Clinical Handbook of Digital Orthodontics. It's coming out very soon, really in a couple of months, by Christmas, hopefully. And for the first time, I've included a chapter where I talk about SmileMate as being the new, like Dr. Rhonda said, the new normal of this is how a new patient consult should be. So our new patient inquiry now has 2 ways of coming. It's either through our website, SmileMate, or it comes through other sources, like people walking into your door, people emailing you, people calling you, dentists referring you. No matter what source they come from, we funnel that source back into SmileMate and say, look, we're going to book you, but before you come in, could you please submit a SmileMate consultation? The value is immense. Even before you come in, the orthodontist is going to give you some recommendations and some approximation of fees. So we have this kind of a flow chart. We have templates that we use. Now you can have the ability to create these templates within SmileMate. you can do that as well. But we have some very specific things we like to share with them. You can even share a booking link with them. But we started doing this system, and I'll tell you what happened when COVID hit. My first 10 SmileMate consults, when they came through our website, I got on Zoom with them one-on-one, and I did a free virtual consult. Then I tested the system because, like Dr. Rhonda said, I'm also very much into efficiency. Then I said, okay, I'm getting here now for a free virtual consult. Now, orthodontists should not be doing that. I don't believe in anything free, okay? And I believe in value, not free. Anyways, then I got my OHT to start doing these. Then I got my treatment coordinator to start doing these. Then I completely automated it. And we got a huge success rate the moment we automated it. Actually, the success rate was much higher of conversion of the patient making a booking, coming in and starting treatment on the day when we completely automated it and removed the video consult too. Now that is our market, that's our system, that's our patient. So this is my little statistics here for you. We didn't do any advertising. We didn't even pay for it. Okay. We literally, we do have some great Google ranking of our website. And I mean, I'm not going to go deep into that, how we have it, but we do have some really, really good rankings. So people do find us. And so we had about 159 screenings. It was actually 170, but about 20 of them were unusable or they didn't follow up, but 159 screenings. So we're literally getting a lead a day from SmileMate with no advertising, okay? And never before we had that many coming from Google because they land on our website and they're prompted to submit this. 90% are booked. That they had an appointment with us, and 80% started on the day. Out of the 90% that got booked, 80% started on the day at that chair appointment. My doctor time to look at these screenings took 3 to 5 minutes. My admin time to book these patients and send an automated email or a template was 5 to 15 minutes. To me, that's minimal effort. There was no Zoom video conference. As I said, we did pilots. And when we did the pilot of automation email, and my book talks all about this. So my book that I'm about to release, and we don't know whether we're going to sell it or not right now, but that book will be available by Christmas, especially for the students that are enrolled in my course. And that book really talks about the system, that how we honed it. So our strategy was very simple. Drive everyone to the one place. Marketing is all about the same message repeatedly. You never want to say something one day, another thing one day, another thing. It's if you're going to get onto a message, the same message as many times as you can in different, maybe creative ways, but the same message, the same tagline, the same thing. So our strategy was always to drive to everything to one place. That's our website. Because why did I do that? Because we understand our patients. Our patients have told us what's great about us. They've told us, we do patient feedback surveys. We know that our patients compliment our website. They say the quality is amazing. They love the content there. They engage with it. So we know that if we drive them to our website, they're going to be beyond impressed. So that was our way of strategizing our marketing. But then what we did was continue to build relationship with them on our YouTube channel, through our newsletters and other channels. So for example, when they first submit a SmileMate, they get an automated email with a YouTube that I have personally recorded for 25 minutes, talking about clear aligners, dental monitoring, attachments, what is retention, why I'm so passionate about creating smiles, some of my befores and afters, what to expect from our customer service. And that kind of YouTube video is kind of sent to them. And I don't have to do this talk to them, right, on Zoom, very automated. And the other benefit I found of using SmileMate was it gave me a competitive advantage. I'm an early adopter. Nobody's offering free virtual consult with a specialist orthodontist, not many places in Sydney, especially during COVID. Practice automations were developed and we honed it to reduce doctor and admin time. We got great feedback from our referring dentists. One of the strategies was we told all our dentists, hey, by the way, your patients can now access us for free with a virtual consult. We got great feedback. Patients were raving about what we were doing. You don't even have to go in. You simply submit your photos. We got great feedback from incoming patients who had done SmileMate themselves and said how easy and how informative it was. So when we hear all of this, since April, and we've had close to 160 screenings, and we've converted so many of them, we know that it's really working, and a very simple, easy tool to integrate. It took my website developer 5 minutes to integrate on a website. Now, I am going to go back to that video that I want to show you how it works. And this is from SmileMate, so it's not made by me, but I think it's good for you to watch it. Now I'm going to go a little bit deeper into my strategies.
SmileMate Virtual Consultation enables practices to easily engage, manage, and convert their prospective patients through remote consultation and instant AI-generated dental assessments. To begin accepting virtual consultations, you can integrate SmileMate Virtual Consultations seamlessly into your clinic's website by adding a simple script into your website's code. Alternatively, you can use your unique personalized web page and share it with your patients. No development needed. You can find both of these on your SmileMate dashboard under Virtual Consultation Integration. Once the virtual consultation page is shared with the patient, they can easily follow the remote consultation steps. They will see a short description of how it works, as well as a tutorial video that will show them how to take the required pictures. They will need to enter their details in the form below to begin, as well as their goals for treatment. Note that this question can be customized in your dashboard, and you can ask up to 10 questions to get a better understanding of your patient's background and expectations. Next, they will be prompted to upload a portrait of themselves. This will be used for their profile photo. Next, they will be prompted to upload photos of their teeth, trying their best to match the reference photos shown. If the patient is on a mobile device, they have the option of taking the photos using the device's camera. There are 5 photos to be uploaded: front on, right side, left side, and a top and bottom occlusal photo. Once this is done, the patient can submit the photos for analysis. When the report is ready, you can access it from your screenings menu on your SmileMate dashboard. Click on the patient's name to view the report. A summary of the patient's condition is available, and you can review the photos of your patient's teeth directly. This report is generated by artificial intelligence, but you can modify the observations and recommendations before sending it to the patient. To change the observation, simply click on Edit Observation and make the changes directly. To change the recommendations, go to the Treatment Options tab. For each observation, you can select the type of treatment you wish to recommend. The options that appear here can be modified by going to Treatment Catalogue, Treatment Lists, and you will see all of the possible treatment propositions listed alphabetically. Clicking into each will let you edit the text, title, and photo. This is also where you can add new treatment options. In your Treatment Assignments tab, you will be able to choose which treatments can be selected for each observation. Once you save your changes, these will be applicable only to new screening reports. Once you are satisfied with the report, you can share it with the patient by simply clicking Share Report and selecting the appropriate email template. These email templates can be modified through Settings, Email Templates. There are many more customization options available to you through your Settings menu. Under Branding, you'll be able to customize the primary colors and add your clinic's logo. Don't forget to click Save to apply the chosen color. Your new primary color will apply to your SmileMate dashboard, virtual consultation landing page, any emails sent from the platform, and the patient dashboard. Through the Notifications tab, you can choose to receive email and SMS alerts whenever there is a new screening available. You can also choose to provide your patients with the ability to book an appointment with you directly from their screening report. Once this option is enabled, the patient will see an icon on their report. We recommend adding a booking system such as Calendly, as this will help automate your patient's appointment requests. If you do not have a booking system, however, your patients can still email you with their preferred appointment times. If you wish to invite your patients to a video consultation with you, you can enable it by going to Virtual Consultation, Video Consultation. You will get access to a link which you can share with your patients to start a video consultation. The Patients tab allows you to manage your prospective patients. Here you will see a list of all the patients that have started or completed a screening through SmileMate. You can add labels to each patient to indicate what follow-up needs to be done, and filter the list if you only want to see patients at a certain step. Clicking into a patient profile will show you a summary of their latest screening report, their contact details, as well as a history of their activity. Here you can review any appointment requests, send emails, and add internal notes, or start a video consultation.
Right, so we'll go back into this and we'll continue on. So that hopefully explains how SmileMate works. So I was thinking about why something so simple. All I did was went on my website and put this big pop-up to say, hey, submit a virtual free consult. We put it on our Instagram, our Facebook. We never paid for any sponsored ads, anything like that. Why was this so positive? Okay, because as a lead generation tool, I spent $0 for generating these leads and getting a higher conversion. So why was this so positive? And it makes me think what SmileMate did is capture something called blue ocean strategy. Some of the most successful businesses in the world use blue ocean strategy. Okay, and what blue ocean strategy is that you create a new market that never existed. Virtual consults for a new inquiry never existed. Thanks to COVID, though, acceptability rose. Okay, people want to do this. The blue ocean created this new market. SmileMate was just positioned right at the right time to develop this market. Okay, and you make competition irrelevant. You really, if you swim in the red ocean, this is what everyone's doing. Okay, it's a bloody ocean. The blue is where you want to be. Always different. But here's the biggest catch. Just by being different doesn't mean you're going to be successful. The biggest catch is to give your customer, your patient, your user, the best value for the lowest cost. Whichever company does that wins and trumps, okay? So SmileMate and Dental Monitoring, in that fact, have honed this blue ocean strategy. Cirque du Soleil used blue ocean strategy. Some very, very famous companies, Deloitte, blue ocean strategy. JC they've got all the signs in the world. Every sign that you see lit up is JC. They have got blue ocean strategy. They keep value for the client. The value is never lost with as low a cost as they can, okay? And how do they know what's valuable to their customers? They talk to their customers every day. So this is where DM, SmileMate, excel. I think they've created a blue ocean that never existed. And not only they gave us this ocean for our customers, for us as users, for our team, they gave it with amazing cost and great value. So obviously, it was very successful. So this is typically what you'll see on my website when you land on cccsmiles.com.au. Bang, it'll pop up. You can't miss it. It's in your face, and it is saying that. It is driving you to do that. So I'm driving this action. Okay, we're securing up future patients. Yes, we've got a great website, but this also helps us kind of go, okay, this is where I want my people who visit my website go. We talk about this on our Instagram, on our Facebook. So we're talking about, hey, we do free virtual consults. We love the QR codes. Yeah, with COVID, everybody's used to QR codes. So we've got lots of these QR codes everywhere. Every signage that we have, people have gotten used to it. So they just snap on and go on there. But the thing is, this is not about, we're selling you Invisalign, we're selling you. It's about we're giving a great service, an orthodontist-driven free virtual consult. And why am I doing this? Well, because I've done a lot of patient profiling surveys. What that means is I understand my customers or my patients very, very well. And how many surveys you have to do? Well, if you do qualitative, you only need about 5 to 10 people. Your top 5, one thing I will leave you with today is if you could go back and your top 5 patients, okay, you go and do an in-depth interview of them, get to know them, understand where they're coming from, how many holidays have they had, what are they doing? You really understand their lifestyle. You really understand their pains. Those 5 people will give you the most valuable information about you and what you do well. And then you've got to take that and build on it. So repetition is key in marketing. Here's my marketing tips. Keep saying the same thing over and over again. Don't lose the message with too many other things. Sometimes I know as a general dentist, you are marketing or trying to advertise too many services to your patients or trying to promote. crowns, veneers, whitening. But I think you've got to hone into one thing and do that really well. So this is a typical SmileMate website. They're going on our website, they're submitting this. I look in my doctor dashboard. This is my dashboard here. You can see this was just a screenshot taken today. You can see that it's also a patient management tool. We can see that this patient here has been contacted. This patient has treatment plan accepted. This is a new inquiry. This is treatment plan accepted. So you can actually just quickly run labels on these patients for a very quick, like a database management as well. And what I love is, you don't have to send the report. To be honest, I know the report is fantastic, but I don't always send the report. And I find that it can be it could be too much information for the patients at times. So I actually choose not to send it, but you can overwrite anything here that you want. You can fully customize the report with any photograph you want, any text you want, whatever you want to say. And the report is very professional looking. You can even export it as a PDF and send it to them. It can tell them about the recommendations you have. They can book an appointment online if you have an online booking system, or you can put a URL to your booking system. And what I like is, they also now allow video consultation tool within the dashboard. You don't have to use it, but they have that option as well. So I really think my virtual consultation flow summarized. Let's just get rid of the clutter. What I'm trying to say is every new inquiry is now led to SmileMate. I will typically walk in during the day and I will ask my staff, okay, all these new patients coming today, SmileMate submitted, not submitted, why not? Because I need to know my patients before they come in. They need to accept my cost. They need to accept my service. They need to accept what I do. And because we do it so well, by the time they're in the chair, they are so excited to start. They're like, I've seen your video, I've gone on your YouTube, I've read your summary. You are the only person who gave so much information to me. I know how pay plans work and I'm ready. Okay, that's the kind of patient you want, right? That's the kind of patient. And this is like the most streamlined a new patient system I've ever run, ever. I've been doing this for 7 years. I've honed the system so well to increase our acceptance, to increase our value, to increase everything for our patients and while keeping the costs as best as possible. And I think this has really, really excited me. And all we did was literally nothing. So as a pilot, I tested it and I loved it. Would we ever go back? No. SmileMate is the new normal for us. So what we've done is really built a great rapport. They're watching our YouTube channel. They're subscribing to it. They know exactly or approximately how much my services are. They know what's included in those services. They've watched a video of me 20 minutes. They've gotten to know the doctor, right? They can see my passion through it. They can see how we do things. They can see our befores and afters through that video. My staff are ready. We have all the paperwork ready for them to get started. All we now need to do is complete the consult clinically. And, this is really, really ultimate, like in social distancing and reducing unnecessary travel. So I hope you enjoyed this. I'm going to shut up now. And I hope you're excited about SmileMate like I am. And you all go install it on your websites because that is like going to change your practice. So thank you.
Thank you so much, Vandana. Thank you. That was really inspirational. That was Stanford University level. We can feel your passion in your presentation, and it was awesome. I really love also the Blue Ocean Strategy. That was maybe one of my first business books that I read because it comes from Paris, a university called INSEAD.
That's right.
They have the #1 MBA in the world now. So
yeah,
really, really good stuff.
Yeah, and I think Denmark and SmileMate have nailed Blue Ocean Strategy.
Yes, exactly. So to everyone listening, you still have the chance to become one of the early adopters to really differentiate yourself and have a strong USP in place when you're targeting your audience.
Yeah.
So, and I know this session is really going well. Our speakers, you are amazing, because usually when we do webinars, over time, we tend to lose people, but this time we're gaining more people along the session. So that's just really awesome. And I know you want one more. So we have one more great speaker for today. My pleasure to introduce Dr. Yap. So Dr. Yap is a partner in a group of dental practices with 6 clinics, 18 dentists, and 4 hygienists, where half of his clinical time is spent on clear aligner therapy for adult patients and the other half on aesthetic and restorative dentistry. He has been an Invisalign Platinum Elite provider since 2011. He is the immediate president of the Asian Academy of Aesthetic Dentistry and past president of Aesthetic Dentistry Society of Singapore. He is also an adjunct senior lecturer in the Restorative Dentistry Department of the National University of Singapore, and he is also a trainer with Minimally Invasive Cosmetic Dentistry Global Academy. He's also a great sports guy, isn't that right, Ronnie?
I try.
All right, I'll leave you to it.
Yeah, thank you very much, Ryan, for the very, very kind introduction. Hello, everybody. Thank you very much for joining us. And thanks to Dental Mind also for the kind invitation to share about my experience using dental monitoring for the past 2 years. And when I was asked to share about my experience, I was actually quite excited because the technology has really helped us a lot, especially during the time of the year. And I know we all heard from both Dr. Rhonda and Dr. Vandaya. It's really very inspiring hearing both of them speak. So today, I'm going to just divide my presentation into 3 parts. We will just dive in a little bit more about what is DM, because I think some of you all may not be that familiar. I think Mark gave a very good introduction. I will share as well some of the benefits that he has brought to my practice and how it has helped everything sort of flow a lot better. And lastly, just a bit about how DM can be used in a bit of marketing, how it can make you a bit different from the practice. And it's very similar to what Vandana has said about how SmileMate is also able to differentiate your practice as well. So let's go into DM. So DM, essentially, I would say there are 3 aspects to DM. We'll cover how it works and what it can do. So the first part about DM, most important for us as a doctor and our team, would be what we call the dashboard. The dashboard is a website to DM, and that's definitely connected to the servers and where all the data is kept. The next part of DM will, of course, be the the DM app, which every patient will have to install on their mobile phone. And the last part, of course, as Mark mentioned, is the brains behind the technology, the AI. And all these actually work together really well to give a patient the whole DM experience. Yeah. And I'll go a bit into detail of every step. But I think what's the most important and why I find that this technology is a kind of a breakthrough and it's different is that although it has a lot of capabilities, it also allows a lot of customization. In fact, there's so much customization that sometimes when we first adopt the technology, we actually need to take a little step back and sort of get all your protocols out ready. And once that's done, then it's automated, and the AI, as the AI learns, the responses gets even better as we move along. And I'll spend a few minutes just to touch a bit about what we mean by protocol, because that's essentially the backbone for dental monitoring. Yeah. So let's start with the patient's mobile app. So everyone is very comfortable with this. So right now, Mark mentioned the scan box. The scan box is something that Dental Mind has developed to make it a lot easier for patients to send in their scans. I'll just play a short 1-minute video from dental monitoring. So basically, the app will guide the patient step by step. There's also built-in videos explaining to the patient what to do, and there's also audio, what we call prompts as well. Yeah, so the scan box is just purely manual. You click on your mobile phone. That's the retractor that Mark mentioned earlier. So it's 2 sizes. Patient puts on the retractor, starts the app, clips the mobile phone onto the scan box, and then the scan box through a magnet clips onto the cheek retractors. And then there are verbal with instructions from the mobile phone, and then they'll tell you what to do. The patient is instructed what to do, and at any moment there's a problem, they can always press the go back button. Yeah, and they're instructed to sort of bite down where the aligners, move the camera left to right, and it automatically takes a video as well as photos as the patient goes along. And then all these are, of course, sent up to the cloud. And this is just a screenshot I took of my computer desktop using my mobile phone of the scans that the patient actually sent in. So as you can see, the quality is actually quite extraordinary. And this was done with the old method without the scan box. That's why you see the blue retractor. So for this, the patient has to have some skill. it still works well, but with the scan box, you get images as good, if not even better than this. Yeah. So how does this the whole process actually work? So once the patients have sent the photos, all this data is then uploaded to the cloud. And as you know, there are many different kinds of AI. Mark has already went through with all of us. But from the clinical side, what happens is that the AI would then be able to do all the hard work by looking at identifying the teeth and the gums. And then once, based on your protocols, depending on the clinical situation, then messages are then sent both to the dentist and the team, and they're also sent to the patient as well. Yeah. So let's maybe have a look at the platform, or what we call the dashboard that the dentist sees. So once you are a provider for dental monitoring, you have access, you can log in into the so-called website or the dashboard, and you get a very good summary of all the patients that you're monitoring at the moment when they are doing the scans. And you can actually go in and you will have many patients, you're able to then sort of screen them out. Yeah. So just zoom in and you can see the list of patients, what's happening at the moment, what kind of treatment they're doing, and when was the last time they actually scanned. And if you go on to the other tabs, every time the patient has scanned, then there will be a notification that DM will actually send to your practice via the dashboard. And for example, if there's a slight unseat, you will be informed that the aligners is not sitting well. For those maybe a bit new to aligners, unseat means the aligner is not fully seated. And that's usually when the treatment is starting to off track. And sometimes if you see the patient 6 or 8 weeks later, the off tracking can be a lot harder to reverse. But using dental monitoring, you actually alert very quickly what's happening. So most of the time, we have satisfactory aligner tracking, and my staff or my DM coordinator only looks at the red circles, meaning that those are the areas that they really need to actually pay attention on. Just a bit closer. I know some of you are using mobile phone, so just to show you the kind of messages that we get from DM. So all this is basically automated. Even things like recommendations to go, not to go, the type of messages we send to the patient, all these will be set up in the protocols. Yeah. And I think today I only have 20-25 minutes, so I'll just maybe run through briefly about the protocols. And if you're keen to find out more, I'm sure the DM rep will be more than happy to run through with you the functionality of the dashboard. So let's just go back. So this is the typical dashboard that we see for the patient. And then there's a timeline. It shows how many times the patient has scanned and the exact date of the patient's scan. And you can zoom in, you can zoom out. The records are all there. And you can compare. Usually the photos on the right would be the latest scan by the patient. So the AI automatically crops all the photos so that consistently every date the views are very, very close. For example, here you can see anterior view, right and left. And then the window on the left would actually be the records of the previous scan. And if you were to sort of click going back 6 months, 1 year, the photos taken a year ago would then appear on the left. And then you can actually compare to the current situation. And let me just zoom in so that some of you on the mobile phone can have a better look. Yeah, so as mentioning, you can see here is 6th of April, the last scan. But if I were to press for the 1st of February, then the photos taken on the 1st of February would actually appear on the left. And if there's any problems with the scan, if there's something that's not fitting well, the gums are swollen, the oral hygiene is poor, then there'll be a notification alert from the AI. And when your staff clicks on this, it actually tells you what's the AI has detected to be wrong in the clinical situation that's being seen. So the other part, of course, is the automated communication of messages that the patients get through the mobile phone. Yeah, and the kind of messages that the patients get, again, as a dentist, you are the one that has full control in terms of the messaging that the patients get with the help of AI. So what you do is you actually teach the AI, this is what I want you to tell the patient when this happens. If A happens, then do B. If B happens, then do C. And I think, yeah. So before I go into protocols, just to share with you, this is the screenshot from the patient's mobile phone. This is a screenshot about a week ago, but basically what happened was after the patient has done the scan, the photos are uploaded, and then the AI sends an automated message to the patient that, we have received your scan. Let me just zoom in a bit Yeah. Okay. When you receive your scan, please take note of the following. You may progress to the next pair of aligners. Well done. So these are customized messages done by the practice. And what you want to do is you want to sort of mix and match a few of these messages so that the patient doesn't end up receiving the same type of message all the time. Yeah. So sometimes it's a no-go, meaning that the aligner is not fitting well. So automatically we'll send another message to the patient. And this is the patient, he gets, good day, we have received your scan. So let's try to improve the fitting of aligners. You try to encourage the patient that they need a bit more time, because what happened is you have instructed the AI to say, hey, if you see this, ask the patient to wear aligners for a few more days. And this is what the instruction that the patients gets, yeah? And so remind them that they need to wear the aligners a little bit longer. So all these are actually fully customizable depending on each doctor's clinical preference, their tolerance for unseat and things like that. So protocols, when you log on to the dashboard, this is the dashboard of the, this is what you see. There are many different protocols that you can create. And DM itself do have their own series of protocols as well. Let me just zoom in. Yeah, so very standard 7-day start, you can have a 10-day aligner protocol, 14-day aligner protocol, no attachment protocol. For those of you all doing photobiomodulation, you can have a 5-day protocol. And these are the protocols that are already available from Dental Mind. And you can always use them to start off. There are protocols also for fixed orthodontics, for retention and other things. So let me just share one of our standard 7-day start protocol. So when you click on that, it goes to the list. There's the name of the protocol, and then you can then describe the protocol. You can then choose how often you want the patients basically to do the scans. Yeah, let me just zoom in a little bit so that everyone can have a better look. Yes. So you can change it to a 14 days protocol, or it can be a 21-day protocol, night-only protocol. You can choose number of days, how frequent the patient does the scan. And then if there is a no-go situation, how many days before the patient will be asked to scan again. Yeah. And if you go down further down for customization, you can look under aligners. You can choose which are the parameters you want the AI to track. Do you want to track loss of attachments? Do you want to track aligner damage, aligner distortion? So let's just dive into tracking of aligner fit, which is what I think most people want to do. Whether you can track, you want the AI to do a slide unseat or not, or how's the seating. So under slide unseat, what happens if there's a slide unseat? What do you want the AI to do? Do you want the AI to just send me information, a note, or do you want the AI to actually send me an alert? Okay, and then what does my team do? So when there's an unseat, the team will get a message. Can you please check against the previous aligner and then let me know? Or can you please write this down in the patient chart that there is a slide unseat? Yeah, so all this is fully customizable. And again, we mentioned earlier the kind of messages you send to the patient. You notice there's 1, 2, 3, 4 message. So what happens is that the AI would randomly choose 1 to 4. All 4 more or less say the same thing, but the patients will get kind of like a random messages which say the same thing, so that it feels as though it's a person talking to the patient. But I'm quite transparent with the patient. I do tell them that it will be monitored by the AI, and you may get messages from the AI. And I myself do go in and send my own personal messages. So you sort of like mix it up so the patient doesn't feel that it's just purely a robot. Yeah. So yeah, so message libraries to share with you all. Depending on what clinical situation, you can sort of customize the answers you want. We have these patients who don't wear aligners. We all have that, right? Naughty patient protocol. Again, I knew you were going to find it hard to keep to a 20-hour wear. Okay, I'm just joking. We don't really have this protocol. I just added this in just for a laugh. But I added this in because I wanted to show that it's really very flexible, and you can really customize lots of different messages to send to the patient. So it's like always fresh every time the patient does a scan. So I'm not doing this justice enough in just 3 to 4 minutes. There's so much depth in the protocols and what dental monitoring can do for your practice. Yeah. So I'll just share briefly what it does for us mainly. So Mark has mentioned there are so many clinical situations that the AI is able to recognize, and at the pixel level. Actually, if you look at the DM manual, there is more than 180 dental situations that can be detected by the AI, and there's no way I can go through all of them, but let's just maybe focus a bit like aligners. Is there a seat or unseat? Are the aligners distorted? Or unless is there a crack and all that. So once all this AI sees that, it will inform your team members, or even the teeth are moving wrongly, there's a gap, and then the AI is able to highlight that as well. Gingival health is able to tell the patient and yourself if there's gingival inflammation, if there's attachment loss. I can monitor hygiene. You can monitor infection. Sometimes the ulcer is formed. The AI is able to pick that out. If you place micro implants, if the micro implants is moving, is moved from a previous place that you put the micro implant, is also able to alert the clinician as well. So yes, there's just too many. Okay, just too many. And again, get your DM app. But although there are so many options, in the end, as a clinician, you have full control. Okay, full control meaning that through the protocols, through the menu of selections and the instructions that you give to the AI, you can really customize the whole patient experience. So what has this brought in terms of benefits to my practice? Yep. I think there are really 4 main things. There's a lot more, but I'll just maybe highlight 4 the main benefits that remote monitoring of our patient has actually brought to us. As you know, I think almost everyone here are probably doing some form of aligner dentistry, and really without a need for me to go into detail, I think by looking at all these phrases, all of us here really understand these are really what we call the headaches associated with aligner dentistry. Of course, sometimes the treatment goes very well. The patient comes in, hi, bye, and it's just a 15-second appointment sometimes because the aligners are fitting so well and it's tracking so well. But in the past, you just had to get the patient in every 6 to 8 weeks. You couldn't let the patient go for too long, right? Sometimes the aligners don't fit. Whose fault is it? Is it the patient not wearing? Or is it what we call my treatment plan is wrong? Am I doing the wrong staging? Are my forces incorrect? So with the monitoring of the aligner wear every 1 week or every 2 weeks, depending on protocol, we are able to actually identify and troubleshoot all the earlier problems that we actually talked about. And one thing very important, which sometimes Vandana did mention earlier about the Hawthorne effect. So, and I think Dr. Rhonda mentioned as well, this is that when someone knows that they are being watched, they tend to behave better. Yeah, and then the most important will be the first 2-3 weeks. So once the patient knows that I'm going to need to scan in 10 days time, doctor is watching me. Once they get started into the habit of wearing the aligners, once the habit is there, things go on smoothly. And that's the reason why you find that many dentists who adopted dental monitoring see their what they call refinement or additional aligner rates dropping down, mistrack or misfits actually reducing. Yeah. Overall, better patient communication because the patient is able to actually send a message to you directly through the app. Of course, they can still use WhatsApp or they can call the office. But it's nice because every message would then be tagged to the case. So historically, you basically know what's happening. All the messages that the patient has sent before is all stored within the app in what they call in a timeline. Yeah. So this example where the patient was questioning whether he should be changing the aligners every 7 or 10 days. And then of course, my treatment coordinator is able to reply, and everything that's being done, it can be traced, because sometimes when you have a lot of aligner patients, you tend to get a little bit lost about what happened for which patient. Yeah. Of course, the other main advantage as well is that I think in terms of unseats, so I think no dental lecture is complete without 1 or 2 things about dentistry. So in this case, you notice this is all taken from the script. The video is recorded from the app itself, the dashboard. And what you can do with the dashboard is you can actually draw on it. You can add arrows, you can add circles. And then all this is used to highlight what are the problems that you are seeing. And then you can just write down the message to the patient. Hey, this is what I'm seeing. In this case, please use the chewies a bit more in the area. The aligners are not sitting really well. And then this is then sent directly to the patient. and then the patient actually gets the notification through the mobile phone. Yeah, so it really increases the efficiency of the practice very much. Yeah. In other ways, we increase efficiency in our practice is the concept of virtual appointment. When you talk to DM users, you always hear this other term called appointment on demand. Appointment on demand meaning that you only give the patient a physical appointment as and when necessary. Virtual appointment is a little bit different. So in the virtual appointment, what we do is instead of seeing the patients every 6 to 8 weeks in the chair, we see the patients virtually. Yeah. And the patient is not really involved. All the patient does is to send in the scan. So on that day in the morning, I might just block out half an hour. And then my treatment coordinator or my DM coordinator would actually open up all the clean checks for the patient for the appointment. There could be 6 or 8 or 12 patients. And then we open up the dashboard for all the dental monitoring patients. And then I will compare, especially for more complex cases, look at their clean check, and then I'll compare that against the DM scans that the patient is sending in. Are the teeth distalizing properly? So during these virtual appointments, that's when I'm still sort of, I still want to have control. So I'm still spending a bit of time on these virtual appointments. I trust the AI on a weekly basis, meaning that I don't check every scan that comes in every week. We only check for warnings from the AI every 7 to 10 days. But every 6 aligners, I just like to go in, just look at the scans and look at the clean check just to make sure that everything is tracking well. Because there are certain things that the AI can't track. For example, distalization and upper and lower. Are the lower jaw in the right relationship? That's one area which I have not actually explored how well DM is able to track that. Yeah. So coming back to the appointment only when necessary, what I call AOD, appointment on demand. For me, we have a virtual appointment to troubleshoot. And if there's any problems, every 6 weeks when I look at the patient in detail, we'll send an additional message or maybe sometimes even a quick phone call or email, or I make a very short video and we send it to the patient. So that every 6 or 8 weeks, the patient gets a little bit, they still get the experience of coming into the practice every 6 weeks or every 8 weeks, but it's a virtual experience. And then every other week when they scan, that's probably done by the AI. Yeah. And unless there's no real problem, we try not to bring the patient in. At this point also, I need to also thank Dr. Grant Duncan. I think one of the big users of DM. I was lucky enough to visit his practice in Adelaide. And this is one of his internal study that he did. Basically, he tracked pre and post DM. So before DM, he had a control group of 100 patients, and he had another 80 groups of patients on DM. And briefly, basically what he found out was that the number of doctor appointments dropped from 7, an average of 7 to 2. There's 70% reduction in doctor time. Okay, 30% reduction in treatment team time. Total active appointments dropped by slightly more than half. Total number of refinements dropped by 77%, and the treatment time reduced by almost 40%. So that's really very significant. And I think there are a few other studies that have been published as well about the reduction in the study time. For me, my experience is really mainly anecdotal. For sure, we do see better tracking that's happening in our cases. And that's what the main reason, the benefit that DM has actually brought into our practice. And just one more clinical case here, you can see that there is a bit of off-tracking on the canine. So the AI has actually warned us about the off-tracking. So it's very typical, what I call things that happen. And this is the typical things that the AI or DM help us to get the patient to bite more on the chewy. And then a week later, when you do another scan, you can see that the patient is back on track again. Yeah. So I have about 3 more minutes left. So I'll just briefly talk about how DM has actually changed or differentiate my practice. It really sort of positions us as an advanced practice. Yeah, if you go and search the internet, you'll be surprised that at this moment, almost 80% of patients are very comfortable using what we call teledentistry in the next 5 years. So of course, if you bring teledentistry into your practice right now, you are really like 5 years ahead, and that really gives them a different view or perspective of your practice. Yeah. giving patients what they want. Yeah. So in Asia, we all love our mobile phones. Interesting statistic, in Southeast Asia and in China, we use our phone 3 hours a day or even more as compared to the United States and Japan. I'm not sure in Australia and the other region, but I'm sure it's somewhere in between. So patients are really very comfortable using their phone, and even as far back as 5 years ago, we always talk about the millennials. They are the one with the most purchasing the power. So more than half of them were all more than ready to use the mobile phone, more than ready to share information with the doctor. Almost 90% of people surveyed find that they really want to have an app which can use to interact with the doctor, and 80% would actually want the dentist or the health provider to use the best technology possible. And I think one big aspect about using virtual care and what they call virtual monitoring is that you really save patients' time. Yeah? And we know time is really money. They don't have to make the journey to your practice just for just a 5 or 10 minute review. And lastly, I think DM also gives us a bit of an edge over the direct consumer products. As you know, there are many straight to consumer aligners. And by adopting higher technology, as Vandana said, going into what we call the blue ocean territory, that really gives us another edge in this getting a very competitive clear aligner landscape. So with that, it's exactly 25 minutes. I would like to thank everyone. So I've covered the 3 different areas. I know I'm going a bit fast because there's so much information to share, but feel free to email me anytime. I'm on Instagram. That's the best place to get me, to send me a message. Or you can find me occasionally on Facebook. Okay, thank you.
Thank you very much, Ronnie. That was a great presentation as always. I'm not surprised. So what I would like to do now is invite back the speakers, everyone. Let's get back on this virtual forum stage and let's have a nice discussion. Does anyone in the audience have any question? Now is the time. Don't hesitate. Our speakers will be dedicating this last part of the session for this. So I'm going to check out the Q&A box. So in the meantime, maybe Ronnie, I'll ask you one question.
Yes.
The first time that you heard about the concept of remote monitoring, was it obvious to you, or did you stumble upon the answers, later on during the adoption journey?
Unlike Vandana and Rhonda, I would say I'm a slightly, I'm not so much an early adopter, although I get excited by new technology. Yeah. So yes, the concept actually intrigued me quite a bit. Yeah, the cost put me off a little bit, to be honest. Yeah, yes.
That's a good point to talk about.
Yeah, so, but I think it's really, as Vandana said, is realizing the value of what it can do in your practice. And I think we sort of dabble in it, and I don't really advise dabble in it. It's either all in. So it really sort of took off when I told my partner, I said, no, we have to go all in. We can't just dabble with cases. I know there are some dentists who start with patients who travel a lot and things like that. But in the end, we found that, all in is a lot easier. Yeah.
Vandana, you said...
Sorry, I remember the very first webinar. And this presentation, you were there. I remember talking about
so you were really very helpful in answering all our questions during that time.
I remember.
That was like 2 years ago. Yeah.
I'm so happy to see your progression, how much you've done, and how you're able to now... You've become a convert. You're converting others.
Yeah, thanks to you.
Ronnie, I know since I've known you all these years from early 2000s when Invisalign was first launched into Singapore. Sometimes, you see it. You see the progression with doctors, and a lot of doctors just want to try and they listen and they want to try it on a few. But I think we all come to the conclusion, and you'll know that from your Invisalign, at some point you have to make the jump. When you make the jump is when you truly realize the efficiencies. You have to transition from an old way of doing it to a new way. If you run 2 systems, it won't work. And we've seen that time and time again. A practice that has got some patients on DM and some without, the clinic doesn't know what's happening and what's not. And therefore, at some point, they'll say, well, dental monitoring doesn't work. The truth is, it's really that the doctor hasn't transitioned from the old system to the new system. So we're a lot better now at helping make that occur. And it's thanks to you guys as the early adopters that help show us what we need to do to improve.
I think that's really important, but also as you're transitioning across, there is a crunch time as you're coming across, and that does require some support when you're actually going from physical appointments to own appointments and your virtual visits. So how long you make that pain point will depend on how long it takes you to decide to jump all in and do it. And the longer you take to implement it for all the patients, the worse that will be, which is backing up what you said then, Ronnie. You do need to jump in and do it. But I do fully get that why people look, let me just do it for my out-of-town aligners to get my head around how a protocol works. Because particularly if you're going to put a DMC in front of your dashboard and suddenly they're now going to look at like 100 notifications, it can be a little bit overwhelming for them. So if you've just got a handful of nuggety stuff just to tickle you into it and then implement it for everybody. I think and you've got to give your staff support and time to do this, because that's quite for a lot of them, if you really talk to them, that's quite a terrifying point at that point when you're suddenly going, hey, you're going to look at that and give me some information back about it. So there's a lot of learning that's got to happen at that point in time. But I loved it when I actually decided I was going to no longer book future appointments for patients. So that was back in 2018. And in August, we had go live. By August, September, November. By the start of November, I'm like, why are we making the patients come in and booking their next appointment when they're on dental monitoring? This is mental. We're not going to do it. And my front desk went meltdown. Like, how can the patient not have an appointment? I go, they do. They have a virtual appointment because we set up a recall system for that. But that took a lot of TLC to get that system in place. And it's amazing now, but there was a little crisis at that point in time. It's kind of fun.
Yeah, I think the appointment, the individual that you use as the dental monitoring coordinator is something that you cannot overemphasize. Finding a person with the right skills. The challenge, as you pointed out, Rhonda, is going from a physical practice into what's that word that was used?
Digital.
And
it's a digital.
Exactly, and that requires, I think, us all to change the way we do things.
Absolutely.
And so sometimes you see doctors who choose a clinical staff member who knows how the practice works very well clinically, but that person doesn't have the skill set to be doing this in a virtual environment.
Yeah, absolutely.
There's some questions here, sorry. Someone's saying you're using SmileMate quite extensively. Can you share with us how accurate is the analysis done by AI, i.e. when the report is generated by the AI, is it accurate with what you observe from the actual patient's oral health? That's for me. Would you like me to answer live?
Yep.
Yeah?
Yep.
Sorry, it just flashed in my face. Okay, so great question from anonymous attendee. So accuracy of DM. Well, accuracy of DM has been published in a September AGO, was it last year, Mark, the paper?
So, yeah.
It's very, very accurate, except on the second molars. That's probably because patients can't take a scan on the second molars. It's as accurate as almost a scan. So accuracy is not the issue. You asked about AI-driven report, right? My experience is now DM is very driven by, SmileMate is very driven by the AI that DM has developed. And my experience has been that when it comes to mixed dentition or children, it gets it not right at times because it doesn't understand missing teeth or generally for children and mixed dentition, I would like to bring them in, then do SmileMate consults generally. However, when it comes to adults, it gets it pretty right. A lot of my reports, and if you disagree with anything, you can easily change it. If you think the deep bite's not deep bite, you can remove it. But I'd say just off the top of my head, how many times it's got it right? I'd say 95 to 99% between that. So it's very rarely that I disagree with the report. However, I may choose not to share every little thing with the patient. They don't need to know every treatment option or every little thing. And this is the beauty of it. You can customize it. But is that correct with you as well, Dr. Rhonda and Ronnie, for both of you? Do you find with children, mixed dentition? I mean, because DM doesn't have the AI for it yet.
Yeah, that's still a bit of a work in progress, but everything that it does report on, I think, is right. It's only if it's not there, it can't report on it. Does that make sense? So if the tooth isn't there, they can't report on it. I actually really love it for the mixed dentition and the littlies, because sometimes the parents and people just want an opinion, and I'm like, jump on the website, send me some photos. And what I actually do is I actually send them a personalized video back with my SmileMate stuff. So I actually have the pictures up. I actually do a little recording. I chuck a slide at the start and end, so they can watch that whenever they like. They can share it if they need to, and they love that engagement with it. And then also it's documented, because if it's just a Zoom call, then you still have to make notes, and it makes work. I don't want to make work as well. So you want it to be efficient and not take a lot of time. But yeah, the SmileMate is great. I love it. And you made some really good points on that too. I was like, yeah, it's such a useful, such a powerful, and I think it's still so underutilized. Like, there's so much more we can do with it even now.
It's blown me away. I was like, oh, how can something so simple just deliver so much value? It's blown me away. With the automation, one thing that I found is when I got on Zoom, I think my time was undervalued because I'm giving this for free. OHT, TC, we tried that. Then we tried, like you said, doing videos, individual 5-7 minute videos. Then finally I said, no, why am I spending time if they're not going to come? Like, we are going to do an automated video. So this automated video goes through the normal spiel that I tell every orthodontic patient. And then I say, to make it, unique to you, come in. Literally the same spill I would give everybody with informed consent, resorption, befores and afters. And I found that actually has worked really well. So my doctor time is looking at the screening saying, I think it's 18 to 24 months, or I need to bring them in, or I can't, and we have templates that just go out straight away. I think that's working really well for us. Yeah.
One thing that
I really like your idea of that.
One thing we've been discussing.
That was really good. Yeah.
Sorry, Rhonda. One thing we've been discussing at DM with the recall monitoring is, and it'd be interesting to sort of kick this around maybe in the future offline with yourselves as practitioners, is you almost need to think that they're starting orthodontic treatment with you as soon as they do the recall monitoring. It's not they're starting orthodontic treatment when the appliance is fitted. They're actually starting now. And you need to have a different change in mindset. It's not when do we start orthodontic treatment? You're actually starting now, but the appliance part of it happens later and that's at a time to be determined based upon your growth and when things happen. So it's a very different mindset, but I think it's quite a crucial one.
Yeah, I agree. And it's going to how you implement this, because that is such a big shift in mindset. I mean, we're still been talking now in my practice about how we're going to roll that out, because it's a little bit easier for the patients that have older siblings that already have DM because they're in treatment. That's okay. But actually to roll this out new and incorporate this into our new patient appointment for what's appropriate, that's going to actually, it requires a bit of thought, and it really is a mind shift. And that's going to be a real, again, another big shift in the practice and how we're going to blend this phygital world, because again, this is a phygital aspect of what we're going to do, how you're going to roll that in. But more and more our Gen Zs, and I'm not sure what we're going to call our next generation, they are going to expect this as the default level of service that you provide. This isn't going to be like, oh, it's just the crazy early adopters doing this. This will be the default in the future. And we have to think about how we're going to position ourselves to meet those needs of those consumers.
Yeah, exactly.
Now, I know some attendees might be interested about knowing, so when we talk about SmileMate and the whole workflow in place, who among you use a CRM system to be able to track all the leads that are going through your website or are giving you a call or contacting you? Because this is something very important. So I'd like to hear your thoughts on this.
Yeah, I am using it. So as soon as the form is filled, straight away it goes into our Infusionsoft or MailChimp, and it generates an automated email straight away to that patient.
Very well.
So for us, because I use Dolphin, I want everything in Dolphin because it's the most efficient way. I can automate so much stuff out of Dolphin in terms of messaging back to patients. Now, the group that I'm also part of also has their own CRM system. But then I have to duplicate in two systems, and I go nuts about avoiding duplication. Like I hate duplication. So I do everything in Dolphin because I can set up a report and I can, I automate my reminders to get extra, like everything is automated for me out of Dolphin. So I want everything in that to actually get it out. So yes, we do that. And yes, we follow it up. And then I can automate follow-up texts and emails at set times, all in the future based on what that goes in and what it is. So that's the way I use it. But yes, we have a way of tracking and following up. But interestingly, you've got to actually set up your systems to be able to count this kind of before you start doing it, because otherwise now, because we didn't have some of our systems set up well to count this when at the start, you need to be able to have them set up now to count them. So in 12 months and 2 years time, we've got some really meaningful data too about actually what happened with these people and where they went. So that's, think about setting up your systems and your counts and your tracking in place for these as well.
Anthony's sending a really nice link. He said, do you use the video to drive more conversions like I do? I think that's a great idea. And I should do that. Like he's sending us a link there. Yeah, that's a great idea.
I think a lot more work needs to be done in conjunction with yourselves as practitioners on how to use the tools to maximum effect in the practice. And what I'm loving hearing, Vandana, is exactly how you're using SmileMate. I think you were the first person to talk to me about saying, well, no, I'm not going to do the video consultation. I'm actually going to do pre-recorded videos. And initially, I thought, well, is that going to work as well? Because I'm hearing different things from other doctors, but you can see how different people think about it differently. And it's why go and do, it's like DM, why go and do something manually when it's a very repetitive request?
Yes. Yeah.
And so I think that makes a lot of sense.
Because Sorry.
I hate being tied down like to the time with the Zoom call, as we're on a Zoom call now, but like you're committed to a time now. But a pre-recorded automation, I can watch it like lying in bed in my PJs at like 2 o'clock in the morning, and that's a good time that suits me to do it. It actually gives people flexibility. And I suspect that we're not even using SmileMate how originally SmileMate was like thought about being created. Like we've all been maneuvering how to use it in such an amazingly different way. I think it's really cool. I do love all the pre-recorded videos more so than my custom pre-recorded videos. That's smarter.
I mean, I just think I thought I'm doing the same thing over and over again. When I do something over and over again, I go, no, make it automated. So for example, if we got nearly 170 screenings, can you imagine if I recorded 170 videos, that's 10 minutes of my time, 15, sending it out, sometimes converting those MP4s because they're heavy files. But I do like yours. It's more individual. It's more personal. Perhaps certain cases you could do it. Perhaps certain, are easy slam dunk. And we've had people who said, this is amazing. I mean, they're not even going and now comparing costs, because not only they got the approximate quote, they've actually got information. What's IPR? What's attachment? What's before and after? What's root resorption? What's retention? They've got all of this without ever coming in. I love it.
Exactly right.
It's a new way. And your question, actually, very first question that I got asked was from Dr. Rhonda, and I was like, how do I answer this? So she asked me on a chat where you guys didn't see, she said, it's interesting. So the dentists that refer to you, if they've got patients who've done SmileMate, how do they do it? And I was like, so far this hasn't happened. I don't have too many dentists around me doing it. So I'm very competitively placed to deliver this. Not even many orthodontists in Sydney are doing it yet. So I'd say it's very, very new, but it might come a time where SmileMate could incorporate something where a dentist does a SmileMate, wants to refer on, and you then transfer to me, as a provider, like Invisalign transfer file. And that would be fantastic. Then you can easily transfer records, notes. That'd be great.
And I'm also thinking for so somebody wants an opinion. Actually, I'm not even thinking dental people. So I'm thinking, okay, so the kids at a childcare center or after school care, and I just need to know, maybe that's a bad example, but I want to know something, some other allied health specialist. I want to know something. And I'm just thinking how I can, right now, I'm going to put in my referral on my website, not just fill in a form and tell me something, actually link. And I want that bit to almost like a third party now to send me these photos, or are they just going to fill it on the patient's behalf? I don't know. and we can really start to give them some information about stuff, which will be really cool.
Yeah.
So
yeah, always thinking of making lives easier.
Yeah.
I mean, I was talking to an orthodontist in the US who owns a pediatric dental practice as well as his own orthodontic practice. And he was still saying that even though he owns the pediatric dental practice, just how difficult it was to create the screening processes within that practice to get the orthodontic referrals. And now the things we're talking about means that actually you take it out of the hands there and you just create systems and processes where it automatically occurs for every single pediatric patient coming through that practice. And this is what it's all about, is just putting in place systems where things just no longer fall through the cracks.
And usually the biggest change is in between our ears. That's where you got to make the change first. The rest of it will come. It's just how you think about it.
Absolutely.
Now, I think now we're reaching... Sorry, go ahead, Gandana.
That's what you
I was just going to ask...
first presentation. You kind of change the mindset, you know? And that's my book too. So I wrote the whole book and I sent it to one of my friends who's an editor, and she said, "You haven't talked about how to change the mindset." And I said, "You're right." So we're writing a chapter now, how to get into the digital mindset before you start doing digital.
Yeah.
Yeah, that's it. Yeah.
Simon Sinek, the why.
Yeah, the why. The why is so important.
You should do a
Ronnie, I was just reading...
guest chapter.
Yeah.
Yeah.
Ronnie, you said though you can't do a virtual consult for new patients.
Yeah.
Can you talk about that? Like how or can you do it, or can you give them? How have you been doing this?
It depends how you interpret the regulations. It states quite clearly in the regulations that you are not allowed to do a virtual consultation for new patients, you know. So not much gray zone in the way to interpret that. Although recently, for the medical side, they have allowed medical consultations online, even prescription and medication. Yeah, but for dental, there's still no clear instructions yet. Yeah, I think for existing patients, you could. You know, and I look at SmileMate, and it's really very, very interesting and quite what they call innovative product. Yeah. So yeah, we're just waiting.
So how would that work if the patient sent you an email going, Dr. Ronnie, I want to know if that about something and a question, could you reply to that? Would that be legitimate? Maybe not a consultation, but you're replying to their question. Is that just not allowed?
Sometimes you hesitate because, you know, there's someone who may not like you very much might just send you such a letter. Yeah. No, I'm just joking, but but if you look at you can give general answers. You know, we always say preface, we are not allowed to give. It's quite clear even before all this virtual consult software that we are not supposed to offer any consultation through any electronic means, even before all these things came about. Yeah. So
you'll come to the party, Singapore, because at some point you'll realize what you're missing out on.
Yeah. So on the medical side, they have actually relaxed the ruling. So we are poor cousins behind. Takes a while. Yeah.
I have a question about.
I was thinking.
Sorry, I just wanted to ask a question about the communication channels that you use with your patients, because going back to what you said, Rhonda, a lot of these new connected generations, they hate emails, they hate phone calls, they just want to send a text. And I noticed that a lot of dentists in Europe and in the US, they're starting to use WhatsApp for Business to communicate with their patients, not even emails. Is this something you started doing?
Well, okay, so I know I sound like I'm plugging Dolphin, but my practice management software has embedded email and text within it. So I have a two-way texting that gets within my practice management software that is just like I was texting on a phone. And it's all HIPAA compliant and everything else. So I text the patients all the time from within my practice management software, and that whole story is maintained. So I don't have to use a third party. I don't have to worry about it. There's like Dolphin Mobile for the doctor plus stuff for the patient, and all of that we can communicate with. So there's that aspect of it, and I can decide when and where I want to send it. I do have an office mobile, so when I've got downtime, I will have my personal mobile and I have my work mobile, because if someone has to send me a picture, I need often, and say they're not on DM or something, then that's hard to get off a website logged into that stuff. So I do have that, but that is like not our default go-to. Our default go-to is within our practice management software. Because otherwise, if it's on the office mobile, you have to export the PDFs and then you've got to save it into the patient's chart. And I don't want to make work. So I want to keep it all in one place.
Yeah. Except if it's, meant for the leads, then you don't have to necessarily copy it in the practice management software, maybe.
That's right. And then all of that will stay inside the SmileMate dashboard until then they go across into it. Yeah, absolutely.
Yeah, definitely.
Can I be honest? I'm not sure WhatsApp is very popular in Australia for businesses, especially when I do the profiling survey. So about once every 2 years, I do really intense, my top 5 to 10 patients, I will do a profiling survey. What that means is I'm trying to get to know them beyond why they chose us, what they love about us. Tell me about your lifestyle. How many holidays you do? What do you do? I just want to get to know my best top 10 people. What kind of websites you visit, Instagram you like. Why do you like this Instagram more than this? So I really go like nearly an hour. I'll sit down with them. I'll say, I'd love to do this for my marketing. And they all help me. They'll go, no problem. And I've never ever heard that they said that we don't have a channel called WhatsApp. In fact, I've done a lot of these interviews, very, very in depth. And if I had ever heard it, I would get it on my business, on my website. But what I do hear is that they love the chat, the email, the DM chat, the chat within the DM.
Yeah.
Love chat.
Yeah. I like that.
Absolutely wow. That is absolutely wow. I mean, the fact they just text your orthodontist on the phone like that is just unheard of. When did that ever happen?
Exactly.
And so I do think that DM chat, but I understand for new leads, the WhatsApp, I don't think is that popular. I have had people from India, developing countries, because I run BOSS as well. So when dentists contact us from developing countries, I find they want to do WhatsApp with us because they want to do my courses. But within Australia, no one's ever even asked, are you on WhatsApp?
Okay.
So that's my perception.
Yeah.
I could be wrong, but I don't think WhatsApp for business is really that popular here.
That could change one day, but so far this is the situation.
So in Europe, it's quite popular. In Paris, it is.
In France, between a provider and his patients, not at all. In the UK, it's super popular.
Yes.
In the US, it's becoming popular. Yes.
Yes. UK.
Yeah, I think it's the number one messaging app would be WhatsApp.
Yeah.
In Singapore.
I remember back in 2016, I was talking to Philippe Salar, and I said, Philippe, in Asia, patients are using WhatsApp to contact their doctors. Doctors are giving a WhatsApp number out so that, if there are any issues with Invisalign treatment, it was in that context, they can contact somebody in the office at all times. And I remember Philippe said, no, why would a doctor want to be contacted by a patient? And I think it took me about another year to convince them, actually, come on, contacting people and calling the reception and leaving a message with the receptionist that goes to somebody, it's just incredibly frustrating. So just amazing how quickly things change, and now, yes, the public, they expect you to be on call. That's the truth.
Yep, that's right. Interestingly, from a generational point of view, our Gen Zs now, which really want, they want face-to-face video chat for a lot of it because that really engages them. But that's actually harking back to our traditionalists and our baby boomers from before, who make up such a small part of the workforce these days. But they wanted face-to-face, and well, actually they wanted in-person face-to-face, and now we've got face-to-face, but it's not in person, it's via video chat. So we're actually cycling almost through our communication styles and what our communication preferences are, just how technology is changing to facilitate that. And I think that's just like, I don't know, it's a little interesting thing when we talk about how we're preferring for people to talk. And I'm also like talking to the staff. I got some older stuff that's like, why can't they just pick up the phone and ring me? And I'm like, because they're never going to. You need to text them. That's how that needs to be.
And Rhonda, I saw something that you even send jokes to your patients through the chat.
Oh,
Yep.
I send emojis.
That.
I send emojis. But jokes are even funnier. So I've got a student here who's doing BOSS. We should click on a student and see what he's learned. James Kwong. I want to know, James, are you still there? Are you listening to us? And I'd love to know what your biggest takeaway has been today. So he's doing BOSS, the diploma, and I see some of my other students here.
I can actually unmute anyone if they want. We'd love to hear your feedback.
Would you like to come on and have a chat? and tell us your takeaway.
Yeah. Use the raise hand feature. I'll unmute you.
James might have actually gone to sleep. You know, he's having a wine maybe right now. It's wine. Well, in Australia it is.
So guys, I need to clock off now. So I'm going to bid you farewell. Ryan, we should probably wrap this up now, but I think this has been fantastic. It's just amazing how the world is changing and how we're all doing this. Now, when is a physical meeting going to occur again? It's a different world. And
absolutely. This is good though, because I love face-to-face, just like bouncing ideas. We got to do this more. It's really valuable.
We'll start to organise a lot more of these things, I think, Ryan, for all our providers to do some of these things. I think it's good to interact and bounce ideas around a lot more than just doing recorded webinars and having this as interactive. So I think that's something we should work upon. I'd like to just say, just stay tuned to DM. There's lots of really great things happening that are going to be coming into the pipe in early 2021. You know, it's based upon the feedback from the customers, them telling us what they want and what needs to be improved is how we make our products better and more usable. And I 100% agree. I think SmileMate is only 15 to 20% of where it will be. You know, the AI is there, but how we use that to interact with the patients and how you do that in a CRM system in a way to automate that process to improve your conversions, that's where there's going to be a lot of improvement in the years to come. All right.
Thank you, Mark. And for the participants, any other last words that you'd like to tell the audience?
For me, I'm good, guys. Anything else on your end? Thanks for your participation, Vandana, Rhonda, and Ronnie. Thanks for your support. And I just love what we're doing. I get an amazing amount of stimulation out of it because I can just see it's all about improving the way we do things. And that is really what gets me out of bed every day. And Philippe, I know, you know, it's how to make it better. So
that's what got you out of bed at 5 a.m. today. So.
Sorry, just before we go, question: SmileMate has API access. That's how we embedded it on our website, yeah? Because Anthony's saying he's been told it doesn't, and I'm like, SmileMate has API.
Yeah, I'm not going to answer that question and give a wrong answer.
I mean, I'm pretty sure it has API access because you get the API key, you integrate it into your website. Nobody knows it's SmileMate. It can be customized to your brand. I'm pretty sure it's got API.
We're working on some things, so maybe it's got some limited in there, and that's more one for Philippe. But really, yes, I mean, the key for us all is to really be putting DM in the background. It's always about the doctor. I mean, I use the analogy, nobody knows what flight control system the pilot is using in your aeroplane. I mean, it's all about the pilot and the airline and all of those sorts of things. And it's got to be the same in the provision of any type of medical or dental care, okay? That's what we're always working towards. The practice management system integration is probably one of the biggest bugbears we have because some of them are so archaic and they're just not constructed the right way. If there's one thing we would love to be able to do, it's to integrate better with the practice management software that we're doing along the way, you know? So.
Yep.
Thank you.
That's a whole nother watch this space. I have to also head off too. So thank you, everyone. And thanks for inviting us. It was great.
Thank you, guys.
Thank you so much. Have a great one, everyone.